that, and we'll just go ahead and get started. Okay. Well, hey, welcome everybody. There's 47, 48 of you on right now. And it's helpful to have at least a couple reference points just facially. So that's not those, I mean, you don't all have to, but we've been on Zoom meetings before. So thanks for being here. This is intended to be kind of a, let's all get on the same page for how we're doing healthy homes in the state of Washington. So we're going to cover a lot of ground from kind of the what is the intent of the program all the way through to the reporting side of things. There's lots of different resources that I will or we will drop in the chat along the way. We're going to reference our manual a lot just so we can kind of tie it back to something that we're all using. And then the hope is to have some Q&A and then some discussion. There'll be chances to chip in, whether it's your own stories or your own frustrations or your own experiences in some of these things. All of that is going to be, it's really going to be valuable as we go through the course of the day today. So without further ado, I'm going to jump over to kind of what our workshop is going to look like and what are some of our goals for the course of the next couple hours. The structure of the workshop, we're going to kind of go progressively through this. We're going to look at the funding. We're going to look at the intent of the program itself. Why do we do this sort of stuff? We're going to move into how do we qualify people to even participate in this program? What does a healthy homes audit look like? Or maybe in the case of a weatherization project, what does a weatherization plus health project look like as far as the auditing or the assessment side? Then it comes to installing. What do we install? How do we install? How do we help our contractors? Then the reporting. And then lastly, we're going to kind of debrief and have a Q&A session along the way. That's kind of our structure. That's our hope for the day. My name is Jake. I'm the manager at the Building Performance Center. I work here with Ross Quigley. He's our director. Ross, you want to say anything else before we get going?
Yeah, just to mention that, so yeah, I'm the director of home improvement at Opportunity Council, which includes Building Performance Center, and also a 3-county weatherization program. And Building Performance Center is the contracted training resource for the state's weatherization assistance program. So we're contracted by Department of Commerce to provide mostly technical skills training to the weatherization network and its contractors. I do want to comment that this workshop is more about program knowledge than developing specific skills, but there's a lot of value here. And Jake's our lead presenter today, but I'm going to be jumping in to ask questions and share some insights as well. And on that note, I do have a couple of objectives for the workshop that I wanted to share before we move on. So it seems like the slide to share those. First and foremost, we're talking about the intent of the program. And my hope for this workshop is that you'll have a better sense of healthy homes work, and that will improve your program's responsiveness to these needs in your community. I think it's fair to say that a lot of the weatherization clients that we're serving today would benefit more from healthy homes upgrades than energy efficiency upgrades. Some of them would, where that's just the greater need. That would be more life-changing to receive healthy homes improvements and go further to improve quality of life. So we have a tremendous opportunity here in Washington to be able to do this work in a way that really almost no other state is able to do. So it's a great benefit to our clients, and we want to make sure that they can have access to it. A couple other things here. I see with the information we have to share with you today, I think it's really useful in becoming familiar with the required steps and forms and tracking and reporting that taken as a whole are, your touch points with commerce. How do you interact with commerce in doing this work? And we can allow an awareness of these expectations to guide and inform our work. And going from that, I think that we're going to be focusing on how do you plan this work? How do you do prioritization? How do you make decisions along the way? If you can get organized with how you're approaching providing these services, you can fold the measures into your already existing program in a way that's not a massive effort. It can be pretty easy. And again, you have clients for whom this is the better service and they will get more benefit out of it. So let's find those clients and make sure they get healthy homes. So that's my little addition. Back over to you, Jake.
No, that's great. That's great. I wanted to note as well, we'll take a pretty short break right around 10:30, just to give everybody's eyes a little rest. Lunch will be at 11:30 and we'll break from, it'll be fairly short. It'll be 11:30 to noon. And then we kick back off at noon and go till 1, have a little short break, and then we're done at 2. We're going to stick pretty tight to those time frames so that we can get through what we need to get through. I wanted to hit a little bit like our lead classes. When we do an EPA lead class, you have to provide a little context before you dig really deep into the regulations and the policy stuff, because that can get really boring really fast. And it helps to have some context for why the heck we're doing what we're doing. There's kind of a broad intent statewide and nationwide when it comes to Plus Health or Healthy Homes funding. But in reality, we're talking still about people. It's less the language on the page and more about the individual in the house. We have been into houses that we'd rather have never been to, but our job is to get out there and to do good work on the home in order to make that house more livable, more safe, more durable, all the normal stuff that we say about weatherization, but it's also to make the house healthier for the occupants. And so we see things like nasty crawl spaces and sewage leaks. We see all sorts of weird chemicals that are inside the space itself that are touted broadly as helpful for keeping things clean. I'm thinking of the commercial yesterday for the Febreze garbage neutralizer or whatever, something you clip on your garbage can and it just pumps Febreze out in the air and it, quote, eliminates all of the odors in the house. When in reality, it's just turning it into a particulate that can make its way past you, the lining of your lungs. And that's not great. So we bring our expertise to each house that we go into. And again, just to remind us, like these are people that we're dealing with. These are households that we are dealing with. These are kids. These are animals. And it's not just a policy memo. It's not just a list of things to accomplish by the end of our funding cycle. It is work that we have funding to use to do good work in these homes. So I guess just, keep that in mind as we get into some of the drier stuff that we go over. Again, the intent of the program, this comes straight from our policy here, is to integrate the following into weatherization projects. Health and safety measures that focus on reducing household hazards and respiratory triggers. The intent is to support improved indoor air quality and injury prevention. And then lastly, to reduce health risks and ultimately healthcare costs. All things that are kind of in the forefront right now, whether it's news, whether it's, well, I feel like it's mostly news, social media reports, anything else that exists out there is just big, bold headlines of how unsafe and unhealthy variety of things are in our environment. So, couple terms to clarify as we get going. We hear phrases like weatherization plus health and healthy homes. It's good to make sure that we know the difference between some of those terms and how we use them in the programs that we run. The Weatherization Plus Health is the name of the Washington State Weatherization Funding. That can include healthy homes measures, along with weatherization and other services. Healthy homes can be a specifically used bit of funding that has its own list, at least as it currently stands. Type of services, including measure installs, and client education that Weatherization Plus Health Funding allows for and supports. There's a little bit of overlap, as you're seeing, between the two of those, but it is helpful to note the difference. One is tied in with another program.
Jake, can I jump in?
Yeah.
Yeah, so if you've been around for a while, there were many years during which the term we used for these types of projects was plus health. So, this is a relatively new development that we've separated things out with a new term, a term that's more nationally recognized, healthy homes work. And you can see at the bottom of the slide here, the reference to the policy memo where these terms have been updated. So it's taking some getting used to. And so much so that, some of the current exhibits and other documents and locations in the weatherization manual have yet to be updated according to this change. So it's going to take us all a little while. It's we're it's a transition to new terminology, but just the state funding is what we call plus health, and this work on homes addressing hazards in the home that could relate to injury or illness is healthy homes. Just one other quick note, the reason that the weatherization plus health label is important for the funding is it helps remind decision makers and especially legislators who are deciding whether to fund this work that it's more than just energy. So weatherization, most of them kind of know what that is by now, but adding the plus health shows that we have a role in improving health outcomes in the state. And that's another important need that they're addressing by funding our work. So thanks, Jake.
Yeah, yeah. So who does this program serve? It serves kind of our general weatherization eligible clients. So our low-income households statewide. But then we can dial it in a little bit farther and we can look at priority populations, whether that's elderly, disabled, or children under 6. And then dialing in a little bit more to be even more specific, clients with asthma, COPD, other respiratory conditions, which can include a variety of things. So the program is really intended to serve a wide swath of folks, not every single household, but it doesn't mean that every single household doesn't have some sort of issue that could be addressed. We just have to pay attention to who we are intending to serve as an occupation. Ross, can I have you talk about this one?
Absolutely. Yeah. So this was a slide I added to Jake's slide deck. And I just wanted to make sure that people keep in mind that when you fill out your weatherization work plan, which is usually in the spring, because all the work plans need to get into Commerce so that all of the data from those can be rolled up into the annual Commerce submission to Department of Energy, the state plan. But your work plan is essentially your commitment to what you're going to be working on and what your targets are for weatherization and other work. So there is a tab in the work plan, which is now an Excel document. There's a tab for this. And I made a few notes from that tab that would just not be legible if I tried to include there. But yes, your work plan submission sets the annual production targets for your program. And those targets are what Commerce will use to measure your outcomes. You're going to be looking at those every quarter at your quarterly check-ins. A couple of things that are noted on this tab in the spreadsheet. Your targeted clientele should be based on your experience with your work population and feedback and experience from other agencies in your peer group. So neighboring agencies, other agencies that have a similar funding level, or urban versus rural, crew versus contractor, et cetera. So consulting with other agencies is a good way to establish these things, especially if you don't have a lot of direct experience to draw from. And I wanted to point out here too that they note your goal should be specific and achievable in 6 to 10 months. So even though our weatherization plus health funding typically spans for up to 2 years, often it's, lower 20 some months, but there's a need to see some progress well before the end of that time frame. Weatherization work plans are 1 year, so it kind of depends on where you're at in that whole cycle. And then it says your activity should be, to meet the goal, should be measurable. So you're going to be talking about what steps you're going to be taking in order to meet the goal, kind of showing the details of your plan. So I thought this was important for us to share because it's an early step in your process. This is before you've served anyone, talking about what your intentions are to do with that, what is currently, I believe, minimum 5% of your state funding. That's surely going to go up over time, what the requirement is likely to be, just because 5% does not accomplish very much in your service area, most likely. So this is one of the earliest places in your work where you're going to be talking about your intentions around healthy homes work.
Awesome. Thank you for that. Yeah, so the early stage intentions kind of lead into our first segment of maybe drier material, which has to do with the second half of the funding and intent. We've kind of talked about some of the intent, see both the intent of the program in general, but also the intent of your agency, of what they're going to do in the next year. The next section is about funding, and funding, in my personal experience, is the thing that's the immediate hitch in the giddy up, I suppose, to use a phrase that my grandpa would probably use, honestly, where you might be able to say things like, hey, we're going to serve this number of children. Here's our goal. Here's our measurable goal. These are the folks that we're going to serve. And then you hit the funding structure and go, well, we'll just wait until April of next year, and then we'll try and take care of it. I know that's how I operate with my own personal budget sometimes. That's difficult to deal with. I'll deal with it in June when it's 2 months overdue. Some of the guidance that exists out there in our policy, policy 6.9.1, is a helpful reference point. I believe that there might be ways for this policy 6.9.1 to be easier to read, in my personal experience, in my personal opinion. But we're going to try and break down some of these things so that they're a little bit easier to understand than reading through all of that there. So here's where we're going to start. We're going to talk about some of this guidance that we have. The funding itself for healthy homes is tiered, which allows a bit of flexibility when it comes to doing the work itself. And then there are different rules depending on Tier 1 or Tier 2. this is being worked as we speak. Delightful. Thank you for that note. So funding, tier 1, standard healthy homes, 6.9.1.1. So funding tier 1 provides standard healthy homes guidance. This is where weatherization program acts as kind of a base, as a base of operations. And what I mean by that is specifically like qualifications. If they qualify for weatherization, they qualify for healthy homes. It doesn't mean that they get it, because there's additional like self-attestation forms that we need to talk about. So this is just like ground level. Who qualifies for healthy homes? Anybody that's in the weatherization program. For tier 1, you have up to $10,000 with a little asterisk. You have up to $10,000 to provide these services. It can be what we call a comprehensive project, where you are doing your healthy homes measures and you are adding it to a current weatherization project, or it can act as a standalone healthy homes project where there's no major measure in the house. That might be old terminology, like the duct sealing or air sealing or attic insulation. There's no major measure to bring the full weight of weatherization to the project, but there's work we can do specifically to make the house healthier indoor air quality and safer for the occupants. Standalone projects, so just healthy homes projects, again, that's no weatherization opportunities. A couple other asterisks for those. Multifamily in total does not qualify. But we've been given this kind of sliver of space where we can get into individual eligible units. So within a multifamily, we might be able to get into an individual unit of an occupant who has respiratory problems and modify something specific to their unit.
Jake, can I jump in? And
Please do.
I want to just ask the audience, why is it that we don't do multi-family buildings in total with healthy homes funding? Any
Like
thoughts on
there's
that?
no way we can isolate the house completely as a unit,
Okay, and why would that be important?
because if I have a client with OCPD and the next door neighbor does things that are adverse to his health, I cannot isolate,
Okay,
let's say, you know what I mean? I cannot isolate the airflow completely. There's no way possible in a multifamily.
okay. We can serve that one apartment though, but so there, we do what we can there, but that's that's a good consideration. But why can't we serve the entire apartment building?
Because the entire apartment complex has not got the same demographic of a person in there.
Right.
I mean,
Yeah, and that's what I'm getting at, is that it really is based on specific need of that household. And apartment building is going to be a whole mix of different households.
Mhm. Mhm.
Thanks.
Ross, I
Thanks,
don't know if
Chris.
you noticed, Tammy put in the chat qualification parameters.
Yeah,
Which might be
good. I
reiterating.
did miss that. Yeah,
Yeah.
thanks.
Yeah. Yeah, that would make it interesting in a multifamily, because then you're really required to all of a sudden pop into each individual house, each individual unit, and each individual unit is going to require its own specific perspective, guidance, and goals. And that's a heavy lift. I probably could have used like an AI tool to do that expanded qualification for standalone projects, just because it feels very if then kind of a thing. For standalone projects, you can go up to 80% of area median income if it's over 200%, or 60% of state median income. So it's kind of an if-then situation. So when we talk about the expanded qualification, that's kind of what we mean. Like if you don't get it in one direction, then maybe check another. It's when our intake staff, I've been through intake for weatherization on our for our own services, and it's like, well, if we can't get you qualified in this way, let's try this expanded way to see if you qualify for our services in state. So if one direction blocks you, then maybe there's another way to get in there. Again, what is our intent? Our intent is to help out the owners of the houses, these places to become more healthy. Federal weatherization funds may not be used on those standalone healthy homes projects, however. So keep that in mind when it comes to reporting and then approving any of that work that you can't use those federal funds. Back to our little asterisk, which we had kind of at the top, up to 10,000 per unit, unless you submit and have an approved over limit request form. Now I went to, and I'm glad I've got some commerce folks on the line. I went to log in to get access to some of these things, and it said, sorry, this site has not been shared with you for our SharePoint website. So maybe if there's someone from commerce that could drop the over limit request form, at least the newest one, into the chat, that would be awesome. Maybe you all have it already, but as much as we can get those resources into your hands today, I think the better. The one that I could find was the one that I filled out in 2018, and I don't feel like that's the most accurate form. So I'm not going to give you that one. All right, I'm going to move on to funding tier 2. Well, let me pause there. Are there any clarifications that need to be made? And I say that maybe biting my fingernails a little bit because we don't want to get off in the weeds too much before we have a discussion later on. But if you're like, oh my gosh, please hold up here. Now's a good time.
Hi there, this is Crystal here.
Hi, Crystal.
Sorry for the rookie question, but I am a rookie. But I do want clarification on the federal weatherization funds may not be used on standalone healthy home projects. And I see another question similar to that as well for the standalone. So just clarification. Can you, I don't know, give me a scenario, or I have multiple scenarios, but can you just clarify that?
I mean, I can.
Jake, maybe I can jump
Yeah.
in here.
Yeah, go
And
for
I'm
it.
not positive that what I'm going to say is answering your question, so feel free to tell me if I miss the mark here.
Okay.
So weatherization plus health, the state weatherization funding, is allowed to go up to 80% of area median income, which is typically higher than 200% or the 60%, 200% federal poverty level or 60% state median income. There might be some cases where it's not higher, but most of the state, it would be higher. So only the state funding can be used to go up to 80% AMI. And so therefore, if you're doing, especially if you're doing only healthy homes work and no other work, you can't use any federal funds. There's other reasons for that too. I think you just need to have energy conservation happen for using the federal funds, but that's the biggest one. And a lot of these measures cannot be done using federal funding anyways. They can only be done with the state funding. So I'm not sure, Crystal, does that help at all? And then also I want to check Nate with his question too.
That helps, thank you.
Yeah. And I think I might have answered your question, Nate.
Yeah, it wasn't I guess it was kind of a question, but like the statement before about standalone, meaning that there was no major measure. My understanding was that you still needed the major measure, although what a major measure is essentially just, you know, the the energy conservation measures, you know, i.e. Air sealing, or like in weatherization plus health case, a heat system, but that the expenditure of those needed to be greater than the expenditure of the weatherization related repairs under deemed measures,
Right.
or a bit different with treat, right? But that this idea was that because of the higher income allowance, the 80% AMI, that you could use it standalone. It was a little bit different, of course. You could bring less funds to bear, but it would still allow you to do these projects that would not have qualified for, other federal funds. And it's an opportunity to sort of partner Weatherization Plus Health with like your utility funds. And like if you get CDBG, maybe that they all have that same 80% limit.
Yeah. Yeah, I think that's right. And so with the CDBG, I think most agencies on the call aren't using those funds, but I know in Kitsap you do. You might be doing some of the same healthy homes type measures, addressing hazards in the home. Whereas with utility funds, very unlikely that you're going to be able to do much of that kind of stuff, but that would be an opportunity to use those funds for energy conservation while you use state funds for healthy homes upgrades.
Yeah.
But yeah, I think that sounds right. Thank you.
Yeah, no, thanks for the clarification on that, Nate. I think that there are a lot of unique situations where funding gets paired in other directions than federal funding. That a lot of agencies have very specific, I know the Opportunity Council, again, has some pretty specific utility connections or other connections that may not be relevant to, say, SNAP or another location in the state. So that's a good clarification. Thanks.
Luisa from OIC. Hopefully it's easy question. So we're able, we've never done standalone, but I really would like to, because it seems a good way to exhaust our funding way easier. If I understand it correctly, just standalone jobs, bill everything to WX plus health, and that's it? Seems a little easy. Is that it?
I mean,
pretty much.
Ross.
I was muted. I think you're right that it's doable. I do want to give a caution here.
Okay.
That I usually give at the manager workshops. Yes, you can put $10,000 to a project, but look at your total budget. If your total budget is such that, and you're planning to do 10 projects at an average of 3,000, and you do one at 10,000, well, you substantially dropped the amount of available funding for the other households you were trying to serve. So usually these caps and limits are a lot higher than is reasonable when you're trying to distribute the benefits equitably in your community. So I'd be really careful with that. And standalone can get you into that kind of trouble where there is literally only one funding source you can use, and you're using a lot of that one all at once. I also would just encourage, your state weatherization funding, Weatherization Plus Health, tends to be the most flexible funding source you're going to find. It lasts more than 1 year. You can, you've got the access to a different priority list. There's all kinds of reasons that it's the most flexible. And I strongly encourage programs to hold your flexible funding, keep some of it available longer and spend out the hard to spend earlier, instead of having that reversed where at the end of a grant cycle, you're having trouble spending out something that's very restrictive. So I would be careful with all of those things, but that sounds right to me that you can do that kind of thing, and sometimes that will make the most sense.
Can I chime in for a second there? So I'm with Rural Resources and we serve 4 counties, but I don't have a problem spending that money because the auditors are very aware to ask a handful of questions, so you can better help the home with a few more questions involved in your audit end.
Yeah, I think we're going to get into that part of it, like determining, what health conditions or health concerns might be present, and documenting those and then using those to justify the work. How to have that conversation, that sounds like a great discussion. So I'm going to flag that. I'm kind of our note taker, at least, I'm not taking notes on everything, but I'm documenting questions and discussion topics. And if we have any questions where we cannot provide the needed clarity, I'm going to flag those for follow-up from Commerce. And also, there may be some things where we see an issue in the manual. We're looking at stuff in the manual today, where there might be an issue in the manual where an edit is clearly needed. So I'll be the person to take all that stuff down and do what needs to be done with it. But I will, great question, Chris, and I'll put that in our discussion list. I know it actually was more of a comment, but I think there's more to say about it. So thank you.
All right, we're gonna move on to our tier 2, which I think we're about ready for. Tier 2, which includes provisional measures. So this is a little bit like a weatherization plus health bonus, or like a we need to do more for this house before we can get to the regular thing. So there's additional funding that's available, but it needs to be paired appropriately. So no longer considered provision. Sweet. Let's just do. It's fun to be able to edit words at the same time. There are cost caps for individual programs. We'll look at it. I'll pull up a spreadsheet here in just a second that's gonna hopefully make it a little bit easier to read. There's a cost cap and an installed measures cost cap. For example, like a weatherization project needing more work to be considered as a probable weatherization project. You got to say you got a roof leak, you've got some plumbing problems, and you've got an oil furnace. You might be looking at a deferral without, oh my gosh, some additional like weatherization readiness funds. Oh, that's great. Okay. Oh, and we've got an oil furnace, even though the homeowner says that it's a real damp heat and they love it so much, or it's a really dry heat and they love it so much and they never want to get rid of it. We can also use some fuel switching money. So there's an additional, oh, there's that word again. Thanks for pointing that out, Maria. We've got additional funding per unit to include those measures, whether it's through weatherization readiness, fuel switching, or potentially even both. So tier 2 just adds additional funding on top of the current plus health funding that we have available. It does require this pairing. And it also requires in terms of rental situations, we can still serve those homes, but we do require an owner contribution, and it's 10%. It's not like back, I remember when I was doing, I think it was matchmaker funding, which was way back when it was like the owner needs to contribute. And that was kind of the extent of the language. And so we, could get an owner to contribute $100 or $1, and that was a contribution. That was a long time ago. It's statute of limitations. I can't be accused for doing anything wrong now, I suppose. But it's a more hefty requirement, that 10%. So rentals shouldn't be off limits, but there needs to be a contribution in kind. All right, and I kind of I'm going to jump a couple slides here because I do want to follow up on my, hey, this is what it actually could look like here. So here's your, like, if you were to use everything, say you were to use your tier 1 and your tier 2, you've got your healthy homes measures, you got up to $10,000. You do your regular weatherization measure cost on the house up to $20,000. All these have little asterisks without the over limit request form. And then your provisional measures add an additional up to $25,000 for that weatherization readiness or fuel switching. So you could have a sizable project. This is what I think a peak without additional approval of $55,000 on a home. Back when I was auditing houses, that was like, we would make fun of you for spending that much money on a house because you probably did something wrong. But this feels par for the course. I mean, maybe not par for the course. I did want to actually open the over limit request form. I have a photo of an older one, but might as well take a look at what it actually is. It's a single page, so there's not much involved, which is great. Just make sure that you have appropriate costs and descriptions. See if I can make this a little bigger. Everybody see that okay? I'm gonna try and adjust it so you can actually see it, unless you're logging in on a phone. Here is, oh my gosh, it looks like they actually used the numbers that they said that they were going to use. Here's your installed measure cost, over 20,000 per unit. We already talked about that as that number there. State funding plus health in excess of 10,000 per unit. Oh, we talked about that as well. Blended braided funding for weatherization readiness and tier 2 funding in excess of, that number is different than mine. The policy says 25,000 per unit, and maybe I'm misreading that. Ross, you want to just put a little note on that one?
Yeah, I'll note that for clarity. So exhibit 6.9A.
Yep.
Says 35,000.
Yep.
For tier 2. Got it.
The rest of it's fairly straightforward. What are the measures you are going to install in a variety of different categories and your total costs? This does require some cost research on your behalf, and then a justification for cost exceeding limit. I like our auditors, when I was a quality control inspector, I would like our auditors to not write a novel, but I want to be able to see the justification in a way that brings me along for the ride, and not like On a Dark and Stormy Night or Once Upon a Time, but just here are the reasons why. You bullet point it, make sure that you are documenting this in a way that encourages your monitor or whoever you've submitted this to Commerce to not only understand your perspective of what you want to install, but also is right there with you. Is like, yes, I understand. Let's do this. Here's why I believe that you've made the right choice. All right, and this is just for reference, this was dropped in the chat by Maria, in case you need to download it one more time.
Yeah, and I want to point out a quick thing here, that the healthy homes portion of this, well, it still says plus
Still says
health
plus health.
measures.
Yep. I'm
Yeah.
fixing it right now. I'm just sending it to Eric.
Awesome. Yeah, that's
Okay,
great.
got it.
So,
Yeah, thank you.
but we know what it was supposed to mean or what it's supposed to say there. I just wanted to note the flooring thing. So yeah, we've got a $10,000 limit, but another over limit type of criterion that we would be looking at here is exceeding 2 rooms of flooring. And that's why the square footage is mentioned there for flooring area. And we're going to touch on that again later. It comes up in a couple other places, but just thought I'd note it while we're looking at it here.
Yep. That down, so we got that. Make sure it's included in the project file. However, your agency retains documentation. We have our own kind of system over here. Make sure those get logged away to be used for not only justification, but future documentation, so that a monitor comes and can see that you actually asked before you did, and you're not going to apologize and ask to fill it out afterwards. Comprehensive versus standalone. We talked a little bit about this already. Weatherization plus health comprehensive projects. This is just kind of mixing the two of them, weatherization and healthy homes. Healthy home standalone may be allowed, may be used only in situations and must be documented. We talked about multifamily as well.
So I have a quick note on this one, Jake.
Yeah.
I think we're actually going to want to change the text in the blue portion of this slide. Just because in almost all cases, you do have to conduct the energy audit to get to this point. And the one exception, and I think that I believe it was Nate Krebs mentioned previously weatherized.
Mhm.
So if, and then I just put something in the chat where, which is a direct quote from the manual. I'll read it aloud. Exception, a new weatherization energy audit is not required if a weatherization project final inspection date is within 1 year prior to the date the client is verified as income eligible for weatherization plus health. It's a bit of a mouthful, but yeah, that's the situation in which you don't have to redo an audit, but you pretty much have to do a weatherization audit. So my edit for this one, Jake, is instead of did you conduct, I wrote it down somewhere. But instead of did you conduct, it's just did your weatherization audit identify weatherization opportunities rather than did you conduct one?
Okay, let's talk qualifying. How do we get folks into this program to do the work that we need to do? To begin with, our eligibility is going to align with our weatherization assistance program standards. That's nice. That feels like a pretty easy way to begin. It just aligns with our weatherization assistance program. LIHEAP energy assistance clients are categorically eligible. If you're eligible for LIHEAP, you are eligible for all of this. Standalone projects, we talked briefly earlier, that kind of progression of 80% AMI, 200% federal poverty level, state median income. Standalone projects, there is a little bit more expanded income eligibility there, which I think goes back to, again, what Nate was talking about, where there's, these weird little slices of the people we serve that fit in really in between spaces when it comes to eligibility. Tammy, now might be a great time, since we're talking about qualification. You mentioned having a question about HIPAA regulations and documentation. Do you mind hopping on right now to ask the question, or do you want to drop it in the chat?
No, I'm good. Obviously my mic works, as you all heard. Sorry about that.
Oh, no
I got
problem.
logged out, and when I came back in, it was hot. So my question is, we do have to, when we do intake, we ask them if they have documented respiratory issues. My understanding is, due to HIPAA regulations, we can't ask for that actual documentation. Is that correct? We just take them at their word.
That is correct. And it feels like a really perfect time to, again, maybe leapfrog. We've already talked about thresholds, so I don't really think we need to go over this slide again, because this is kind of the same stuff we've already talked about, is going straight into the attestation form. And this is kind of what you were talking about. I was part of that crew back in the day that was, you could do, I think it was like up to 8,000 with like the documentation, and up to 4,000 if they were self-attesting. And that is gone. The HIPAA situation has said we can just use the self-attestation form, and it's a single cost across the board. So this form itself, this is actually, I'm going to pull up the one in our manual here. And I think that I tried to bookmark some stuff. So let's see if it works. Hey, it works. So this is from our manual as it stands right now, the self-declaration of qualifying condition for weatherization plus health project. This is another one of those pieces of paper that you need as part of your qualifying for Healthy Homes funding. It needs to be filled out, it needs to be in the file, and it needs to be available as monitors and as Commerce come to look over projects. The person that would fill this out says that at least one household member has a respiratory issue or has a safety issue within the home. Slips, trips, and falls, asthma, COPD, or other respiratory illness. Again, we are not required or necessarily allowed to dig too much deeper than what this form states. Does that make sense? Once they have signed, this form is all we need to open up the door for that healthy home. So they've qualified as a home under the income thresholds. Now they have qualified for, please share a fillable form. Ooh, that would be nice. I think I've got the one that the Opportunity Council has made, which is a little bit adjusted for our own. I'm wondering, Steve.
Can I ask a quick question?
Yeah, Nate.
So this is something that's come up in the past for me, but I was under the understanding that to serve a client with weatherization plus health, they had to have a respiratory illness. If there was a slip, trip, and fall hazard, so for example, say you've got a 90-year-old client who with a walker, but they say they don't have a respiratory condition, in the past, we did not use weatherization plus health on them. Is it possible to serve a client that just has the slip, trip, and fall hazard issue, or do they still, must have the respiratory issue?
My understanding is either or. It's not a both and.
Okay.
Well, maybe you could do both.
You could do
but
both.
You don't
Yeah,
have
definitely.
to have a respiratory issue in order to provide slips, trips, and falls hazard prevention.
Right. Okay. I
think that is new, Nate. I mean, this is one of the parts of the program that has evolved over time. So it used to be the way that you were expecting it to be.
Cool.
Jake, when you go back to the slide, I want to make a quick comment on that. Yeah. So just the wording of the slide, I just want to be careful about how we lead people on this. It says self-attestation may be used to identify health-related need. I plugged in the policy language that I found in the manual that is local agency staff shall obtain self-declaration. I'm not like super up on shall versus must versus may, where do those lines get drawn? But I think we're saying it's required.
Yep. No,
So
I can hear Judy Darst in my head.
Yeah. Okay.
Yep.
Awesome.
Yep. No, that's great. Yes, avoid medical diagnosis. Please don't. We don't have to anymore. I know that can still be, it can still be a part of the conversation if the homeowner offers it, but it is not part of our responsibility to ask for a doctor's letter or a medical diagnosis, or like we would take pictures of inhalers back in the day just to prove certain things. That is not part of it anymore. So stay away from the getting doctor's approval.
I think adding on to that one, Jake, and I don't know if this one comes up elsewhere in our discussion today. Pretty sure it comes up in the Healthy Housing Principles workshop or trainings that we do, that we're not claiming to be providing any kind of treatment for somebody's health conditions. So we're addressing hazards, trying to reduce hazards, but we can't make any claims about whether their health will improve. So just want to be really careful about that distinction. I think it's a lot easier to see that when you're talking about slips, trips, and falls. It's like we might, deal with a tripping hazard over here, or add some grab bars over here, but we're not going to claim you have no more risk of falling anymore. We never would claim that. And it's the same with respiratory issues where, hey, we might be able to lower your exposure to air quality hazards, but that doesn't necessarily translate into a specific outcome. And so just making promises is dangerous.
Okay, so for the, Tammy has a question. Do we have a breakdown of what a respiratory illness is? Are allergies or CPAP users? This I would love to defer to any folks at Commerce, because as my understanding reads it, we leave it at asthma, COPD, or other respiratory illnesses. And if it affects your ability to breathe, it would qualify under that other respiratory illness. We don't really have a hidden list somewhere.
We don't, and I do think, yeah, that would lie under the other respiratory illness in my opinion. Allergies, CPAP users, they obviously have a respiratory
Right.
issue. It can fall under that.
Yeah, I think the one thing I would just add to that is, is a CPAP user more vulnerable to, breathing particulates? I think maybe the answer is yes, but I would want to be careful of like, are the things that we're addressing likely to be beneficial for the type of thing they are experiencing? I think the answer is probably still yes, but there might be some outliers where the answer is not really yes, and I would prioritize the use of funds where the answer is yes.
Yeah, and this makes me go down the justifying pathway. If I was an auditor, I would be trying to figure out how I could justify doing more stuff, even if maybe I was stretching it a little bit. Like, what we are not saying is that other respiratory illness is future illness, is because particulate matter is not good for you, and nobody in the house currently has a respiratory issue. We're not saying that you're self-declaring that you will have a respiratory issue in the future. Does that make sense? I know for myself and my household, we don't have any asthma or COPD, and I can't say, please use Healthy Homes funding on my house, because without it, we are all going to get asthma. That's not what we're trying to do. We're not like that might be a really good thing, but it's not necessarily the proper use of this form.
Jake, I'm gonna flag that one for some further discussion, because I'm sure that, the day after you say that, somebody on this call is going to go into a home and be like, oh my gosh, if you continue living in these conditions, this is going to happen. So we should talk more about it. I'll just add that for later.
Yeah, I like it. Cool. All right, there we zoom in really far. I want to bring up, well, maybe I don't quite yet. I'm looking where we're going next, and I think I wanna wait. Okay. There's not a lot to qualifying. If you qualify for weatherization, you qualify for Healthy Homes funding. If you qualify for LIHEAP, you qualify for Healthy Homes funding. You need to fill out a self-declaration form, or you need to have your client fill out a self-declaration form. And provided those two things are accomplished, that household is qualified. Yeah, it's nice to leap past something that's at least a little bit more straightforward. When it comes to the auditing process or the assessment process, this is like, now you've got a household that is a thumbs up for standalone or comprehensive, that work is going to happen that involves some Healthy Homes measures. Now we need to make sure that we've got the staff to do it, the training to do it, and the understanding of what is required when they're on site. This feels, finally, we're into like areas where I kind of know what, I know more about this than I know about funding structures. So as an auditor, those folks that go into the house that are going to make any of these diagnoses on the home or a work scope to progress with, they need to be trained, according to Washington State, at bare minimum, the healthy housing principles. And those of you who've been through that class, you know that it's really based around the keep it principles. There's 8 of them. There's a debatable 9th in there, but it's like, keep it safe, keep it well maintained, keep it ventilated. Those kind of glasses are what you put on before you go into a home to try and focus your attention on different things within the house. The other thing that is okay is the Healthy Homes Evaluator. We haven't trained it properly at the BPC for a while, but that's another training that is accepted as one of those that auditors can take. There are other options that are out there. I think within the policy it says, or other training as deemed appropriate by Commerce and the Building Performance Center. But the one that I think is the easiest to do is the Healthy Homes or Healthy Housing Principles.
Jake, just to add a little clarity, because this is the type of thing that generally causes a lot of confusion. The training is required, the certification is not. Sure. If you have done Healthy Home Evaluator training, which we no longer offer at BPC, but that's what we used to offer, it never expires.
Yeah.
So those are just some questions we often get. You don't need to certify, but you do need to complete the training as an auditor working on these projects. It's just the training, and other trainings could satisfy the requirements, such as, we should have probably written these ones out here, but Healthy Home Essentials, but Healthy Housing Principles is the current one. That works too.
Yep. The goal again of that assessment, which is going to be paired, typically is going to be paired with weatherization, but not always if it's a standalone, is to identify what those health and safety issues are. So it's looking specifically for ways to improve indoor air quality, ways to improve safety and mobility throughout the house. We have 3 forms that are required for our Healthy Homes assessment within the weatherization manual. Those 3 forms that we use, they're called the Client Health and Safety Packet. It is the Informed Consent, Observed Conditions, and the Pollution Source Survey. I would highly suggest treating, let's assume it's a standalone, so you're not bringing the regular weatherization stuff there. I would highly suggest bringing your regular weatherization mind to a healthy housing or a healthy homes audit, because you look at things like house as a system. Don't take healthy homes inspection or assessment as just a, let's see whether the list of items we can install are appropriate here or not. Treat it as house as a system thinking. If I adjust this, it's going to affect that. If I tighten up the house, the water heater might backdraft. All of those types of things should be under consideration as you're going through the audit. We're going to take a look at each one of these forms as we go here, so I won't bring them up now. Let's see, use the Healthy Housing Principles, use your training, use your Keep It principles, and then, like any assessment, you are going to document. The worst thing that you can do is take the bare minimum of photos, because you're going to end up going back out to the job site to take more. You're going to forget what the label said on this one thing or that one thing, and having photos to justify, to document what you saw is super important. So take lots and lots of photos. Stephen asks, how long does a Healthy Homes Evaluator certification last? 3 years. So the Healthy Home Evaluator lasts for 3 years before you have to renew. The Healthy Housing Principles never does. If you take that test through BPI, it's like a 100-question online test, like the Building Science Principles. That certificate is yours to keep forever.
Okay, Jake, I'm going to add a question on top of Stephen's that I'm stumped by. What if you don't have record of having attended the training? You did have the certification, Healthy Home Evaluator, but it has expired. Are you then out of compliance to be an auditor?
So you're saying we have you have documentation that you
used to be certified,
that you passed a test at some point, but not that you took the training. I think that comes down to language in the policy Let me just see if that's not going to be the right spot. I think this might be one that we want to come back to because I think it's going to be language.
Yeah.
And very specifically, it's going to be, well, let's see how quickly I can get to it.
I'm going to flag that one. Keep going, but I'm going to flag that one for just additional clarity needed. We're, follow up.
My concern is that we have either given ourselves the language that training is required. Oh, it's in here. I remember. We're getting close here. Or maybe I've already gone past it. If the language states that training is required, then I don't know, commerce folks, are we good with it just being, there we go. Training and certification requirements shall acquire at a minimum healthy housing principles training or any equivalent training that receives prior approval. BPI Healthy Homes Evaluator training or certification. So maybe that answers our question. At least just in language as it stands right now. I wouldn't feel great if somebody was throwing around a piece of paper that says I took the Healthy Housing Principles certificate test and did not do any training. Because that test is open book and untimed.
Yeah, but it's also if it's an expired certification. So I'm still going to put this down.
Yeah, do.
Because that's a scenario that I don't think was anticipated when writing this policy. So I'm going to put it down for some follow-up.
Can you also flag that it's policy 9.2.1.2? All right, moving on to some tools and forms. Before we get into the actual client health and safety forms, I wanted to take a moment to, I don't know, I guess it's maybe showing off. Maybe it's just bragging. We have our conservation education department is great. And Aaron, our manager of that department, has created a lot of really helpful and usable documentation over the years for being able to have conversations either on site or over the phone to help dial in the process, dial in what we're hoping to look at a house before we even get out there. So this is a photo, but let me actually pull it up here, of something that we use on our side that helps us to narrow down what we're actually looking for. And if they are a Healthy Homes client, we can kind of project the inventory that we might be bringing out, or on a house by house basis might be purchasing to bring out to the job. So name and age, diagnosis or other respiratory illness, bed sizes, pillows for some of, again, the supplies that we'll have later on. And then there's a lot of these other different items that we might like to ask. You might choose not to ask, depending on how deep you want to get into a conversation. Treated in a doctor's office, hospitalized overnight, any notes that you want to add to it. Suspected triggers, if the homeowner has any idea of what their respiratory problems, episodes, or attacks might be related to. This is helpful for us to know. If it only happens from July 30th to September 1st, then maybe, I don't know, that's wildfire season for Whatcom County, at least where we get stuff kind of drifting in and out. Maybe it helps us get a better perspective on things. Pets are always a difficult one to talk about with homeowners when they know that the respiratory problem directly relates to the animals they have in the home. We're not to put too fine a point on it, but we're currently dealing with a little bit of that in my own house. We think that my son might have some respiratory stuff, some allergies, and we have a dog and a couple cats, and they roam the house. And so, do we have a plan to get rid of our animals? No, but so be careful. I mean, all of these things, a person's home that you're getting into. So be respectful when you ask some of these questions. So this is, again, this is an application process. This is a documentation process that we use specifically at our agency so that we can dial in kind of what we're looking for in the house. It's nothing more than that. It is not a replacement document for an assessment on a home. It is not intended to be the be all end all. It's not a phone call audit, none of that. It is another checklist. It is another prompter for asking deeper questions for what you can find out about the house. I'll pause there for a moment though, because I'd love to hear if any other agencies are using some sort of an intake survey, an intake document, a checklist, a conversational type of document like that before they visit the house, or even as kind of an initial part of their audit when they go to the house. Nate.
Hey, Jake. So I asked in the chat about, do you guys have all of your weatherization clients fill out this form, or kind of what, two-part question here, what prompts somebody to get this form put in front of them in your agency?
Well, Kyle, are you finished with your lunch?
Yes, sir.
All right. Can you speak to this form from your capacity?
Yeah, from what I gather, our conservation education folks, when they do just the general weatherization intake process, they ask one question, do you have asthma, COPD, or other respiratory problems? And if they say yes, then that prompts them to fill out this form.
Okay, yeah, that's kind of similar to what we're doing. I mean, we try to prioritize Healthy Homes clients above our general weatherization pool. So our concern has been sort of balancing, making sure that we're asking everybody the question without kind of catching everybody who, if you ask somebody like, are there any trip, slip, or fall hazards in your home, or do you ever have respiratory issues?
Mm-hmm.
You catch a lot of people.
Yeah.
And that's kind of the balance where, kind of to what Ross was talking about, we're trying to make sure that we are directing this funding to people who really will benefit from it. And so, yeah, that's kind of something we've been curious about on this workshop as a theme, is like kind of how are other agencies prioritizing and so forth. And so, lovely form though, by the way.
I will take zero credit for it, but yeah, I think it is helpful. The ability to, because what we're also, I guess, trying to do is to maximize our time with any project. So if there's the ability for us to focus our attention or perspective before we get to a job site, that helps. If there's an understanding that there might be a slip, strips, or falls hazard before we get on site, that allows us to direct our thinking and maybe even start, messing with budgets in our head before we go on site. Tammy asks, does anyone ask the question in their everyday intake? So agencies that do intake without necessarily the specific Con Ed department. Yeah, Louisa says we do. Anybody else ask that question in everyday intake?
Skagit County we do, but we don't make it the official diagnosis or whatever you want to call it. It becomes a note for the auditor as a reminder. We have it as a part of our pre-audit interview, is what we call it. While we're at sitting down going over what to expect and stuff, but it's just another step to make sure that this is a part of the mindset going into an audit as a potential part of the project.
Donnie, when you're asking some of these questions, like, do you have like 2 or 3 questions that you typically ask? Is it like, do you have any slips, trips, and falls or any respiratory problems, and then you move on, or is there a different type of question you ask?
It's pretty straightforward as far as that goes. But I adapted a little bit to it just because during like the COVID era, when you would ask somebody about potential respiratory illnesses or somebody in there, I found that they would kind of get scared to answer that truthfully, thinking that
Sure.
that might make it so we can't do some work. So I just add a little reassurance on that form. Or that part of the question. It'll be something like, does anybody in the house have asthma or any respiratory issues, or are they susceptible to trip, slips, and fall hazards? And sometimes they need a little clarification, just like, have you fallen in the past 6 months, and is that a concern? We deal with a lot of elderly clients, and so that's usually the most prevalent factor out of this form that we deal with. And yeah, that's pretty much it.
Very cool. Louisa, do you mind if I ask you the same question? Is it a pretty straightforward list of questions, or do you have some kind of specific or pointed questions you ask?
No, exactly straightforward. We do exactly what Donnie does. We just make a note on their end, on our end, so when the auditor goes out there, they're aware that they can use WX plus health funding on it.
Awesome. Awesome. Very cool. Very cool. Okay. If any other agencies do have checklists or some sort of a document that would be helpful to share, specifically for agencies that may not have something like that previously created and are willing to share that, feel free to either drop it in the chat or send it around. And if you are an agency or somebody representing an agency that would love something like that, just kind of keep track of some of these folks, and you can reach out specifically. I'll put this one in the chat here too. All right. Okay. Well, let's continue on. So the packet of information that we are required to go over and ultimately have filled out. Let me head to my bookmarks here. There it is. So this is the health and safety packet here that includes the informed consent, the observed conditions, the pollution source survey, which we're going to take a look at each one of these individually. And so the first part of that happens to be our informed consent. And this, I remember back in the day when we'd have individual pieces of paper for each one of these different sections. It was basically I went and I observed a few specific items. There is redundancy here. You'll see the redundancy, and most of you already know where the redundancy exists, but there's mold. Here we're looking at mold in the home. Is there mold in the home? Where is there mold in the home? And the work that we are going to do, actually, I'm going to make this bigger. The work that we are going to do is not going to promote new mold growth. Here's what we're going to do about existing moisture conditions. The lower half is if you don't want to get a big fat pile of additional stapled pages for this brief guide to mold and moisture, we can give you the link to it and go there. And that happens to be similar for a few different items: asbestos and mold. And I should just keep this one up because we can just use this. Mold and asbestos and lead and radon. And then provided we have documentation of theirs signed, I've signed it of my own free will, nobody coerced me into signing it, then that is the first part of our Healthy Homes Assessment. This is not a list, obviously, of what we are going to do in the house. It is just the client understands these things could be in their home. All right, all good? I think this one we all know. All right. Let's move to observed health and safety conditions. In this case, we've got another document that looks at what we evaluate in the home. this helps to support client education in specific. So we get all these individual lines, some which have reference points to the pollution source survey, which is pretty cool. But also I would suggest not only describing or adding any comments or actions needed, but follow up with some photos. Like if you're going through the house and you see a biological hazard, you see a sewage leak or mold growth or mushrooms growing in crawl spaces or closets, take a photo. Label that is a reference point. Hey, I photo 106, blah, blah, blah. Take down that as documentation. This is a fairly exhaustive form as a directive, as a reference point for these observed conditions. So whether you're looking at building structures, asbestos, drainage, electrical, pay attention to these things when you get out to the job site. All right, let's.
Jake, I have a
Yeah.
question. Can you go up one more, the observed conditions? Let's see. I think I'd like to ask if we can, how many agencies are actually giving a copy to their, are they doing it to just the renters, or are they doing the homeowners as well? A copy of the form.
I'll let that one sit out there for a minute. How many of you are, when you fill out this, not only do the occupants get a copy of it, but also the owner in case of rentals? Donnie says copy to everyone. We don't do rentals. Just to the occupants. Is there any reason why it should avoid going to the owner in the case of a rental situation? I'm trying to think of reasons why.
We just give it to the occupant. Okay, it's just making sure. Thank you.
Yeah.
I want to
Hey, Jake, this is Kyle next door to you.
Yeah, buddy.
This is kind of in regards to a current client too, with the landlord renter situation. Isn't lead paint, like if you test or find out there's lead paint, aren't you required to let the owner know, and then aren't they required to do something? I don't know. I'm just asking.
I mean, when it comes to lead, that is absolutely true. If an auditor notes that lead is found, like documentably found, that needs to go to the owner of the house. Yes. Some of those that are mentioning privacy issues, I understand. Can you tell me, and thus the rest of the group, why that's an issue? Like, what part of this would violate the occupant's privacy to the owner? The health conditions of the occupant themselves, I would imagine. Yep. Yeah. I think if I'm looking at this form, if I was the owner of a home, I would want to know most of this stuff if it came up, to be totally honest. But yeah, that very, very first line, any obvious health conditions, weatherization materials might aggravate, we are immediately documenting any sort of issue with the home. I don't know. This is a tough one for me.
Jake, I could also imagine, I mean, I agree that that's problematic to be sharing anything that the client says with their landlord for that line. I also think that there could be some kind of behavioral things that we would be documenting that could feel like we're telling on them to their landlords. That could be an issue for trust and our ability to work with them, privacy. I do want to note that it says at the top, you must. So, or, I don't know, it doesn't say must, but it does say to do it. So I do kind of want to flag this one as well for additional kind of a follow-up from Commerce. We don't need to get too deep into it now, but it seems like a worthy discussion.
Yeah, it sure does. It's always fun when we have a lengthy conversation and the answer, at least in writing, is right at the top.
But most of the people, or really everybody who responded, said no. So I mean, I think that's an indication of there's just our priorities aren't totally aligned here. We need to protect privacy of the client above most things, and this would be an issue. So I think we have to fix this.
Yep. And Commerce, you've heard and seen nothing here. So feel free to, if you put down that you don't do it, I don't know if you can delete your comment, but there you go. I'm going to move on to the pollution source survey. It's the final one. It's the final one of the client packet, client health and safety packet. And it is strategically geared around each of the Keep It principles, which again, if you've had the training for Healthy Housing Principles, Healthy Home Evaluator, you will be familiar with. It also kind of does a similar job as the previous form. It supports client education, justification for your healthy homes measures. Make sure you add notes where applicable, and photos. So before we have a conversation later, let's just make sure. Trying to make sure if it says anything about the owner getting a copy. In this one, so the Keep It principles, we're not going to do a Healthy Housing Principles class right now because we don't got time for that. But I will note as we go through each one of these things, you're going to see that they all have some sort of relationship with our intent from way back at the beginning of our time together, that it is to address health and safety concerns in a home, respiratory issues in a home, and slips, trips, and falls. So keeping it dry. Why do you suppose keeping it dry would be helpful in a healthy homes project? Thanks, Matt. Yeah, mold growth. You get more dampness in a home, you're going to end up with mold problems. Eventually, you're going to get rot. Steven says durability. Thanks, Annabelle, for mold as well. Yeah, we want to pay attention to those things. Keep it clean. I remember having a house where the fireplace that was used had a bunch of stuff like just piled up in front of it. It was still the heating season. They just kind of moved it out of the way when they were ready to make a fire. That made me nervous about not just the cleanliness of the house, but the accessibility, the potential safety concern of having something catch fire. Keeping it clean is something that we pay attention to inside of the house. Keeping it safe. Keeping it safe feels maybe needlessly broad in terminology because that's kind of the whole thing. But if we look at what questions are being asked, we can kind of focus down on indoor air quality and kind of combustion itself. So we've got cars in attached garages. We've got paints, solvents, thinners, and pesticides in the home, carbon monoxide detectors and smoke alarms. So we're really talking about pathways for vapors, for gases, for things to enter into the home. Keeping it well ventilated. Keeping it pest-free. Okay, so keeping it pest-free. It's not always cockroaches, weird little ants. It's not always, it could be a mole that drills his way into your crawl space and gets stuck. But understanding where to look for the signs for pests in the house, where to look for storage of insecticides and rodenticides in the home, or heaven forbid in the ductwork. It's uncomfortable. Those are those types of situations where, to our conversation from earlier, where maybe we revisit the whole when could somebody end up being sick in their own house, even if they don't have respiratory issues now? If you go to a house where you are actively finding insecticide or rodenticide in air delivery pathways, maybe that's worth a conversation. All right, keeping on. Keeping it pest-free, keep it contaminant-free. Here's where we're starting to talk maybe a little bit more about, we've got lead paint referenced here. We've got tobacco smoke inside the home. We could probably expand this to smoke of a variety of types that you might inhale or exhale. Vermiculite or other presumed asbestos-containing material in the house. Unusually strong odors. Can those of you who have done audits before, can you smell a house if you think hard enough about it right now? That like dryer sheets and rodent droppings kind of thing that just emanates from a house before you show up? Yeah, not my favorite. The unusually strong odors. May this be my gift to you. You can wear a mask with organic cartridges to an audit. It's okay. This is my gift to you. It is okay to do so. You do not have to suffer under an N95. You do not have to just say, I'm bigger than this, I'm fine. I have done entire audits with my full face mask and the organic cartridges on before. That's all right. All right. So what was that one? That was keep it contaminant free, keep it well maintained, keep it thermally controlled. Michael says, yeah, thanks for that. Matt, mildew, cat urine. Yes, indeed. Chris Driggs, let him know to not put rat poison in the ductwork. That would be a good thing to do. Would be a good start for the day. And then keep it thermally controlled. Is it unusually warm or cold in the home?
Hey, Jake.
One of the things that I appreciate about this form is the next couple pages.
Jake, can I jump in real quick here? And I think I heard another voice, but maybe it was just us competing. This is the pollution source survey, and almost everything in here is referencing some sort of chemical or biological toxin to humans. The one exception is kind of the keep it well maintained gets into tripping and falling hazards. I think this is a great guide for just the overall hazards in the home. And again, it goes beyond pollution because slipping and tripping is not a pollution related event necessarily. Maybe there's chemical spills could cause it, right? But I think that I want to get into a discussion later on about what kinds of healthy homes work we might want to do that's not in the sort of narrow definitions of respiratory health and fall prevention. There's more that we could do, and I think this document is a pretty good guide for looking at some of those things that aren't quite in either of those categories or not clearly so. And I think we'll even want to go beyond this guide, but this is probably one of the best comprehensive lists. And I hope that as the program evolves, there will be more guidance for some of these areas that fall outside of the, again, indoor air quality and fall prevention focus.
Yeah.
So just flagging that stuff. That's all. Thanks.
Yeah, that's great. I'm noting that we're 2 minutes before lunch. But I think that our best move is to just take a brief look at this assistance document that's here. We are not asking you to go out to a job site and look at let's pick up like paint, solvents, thinners, and pesticides stored in homes 0, 1, 2, or 3, meaning few, several, or excessive. Like sometimes you need guidance to fill out the right number here so that we get an accurate picture of what's going on. This reference guide down here breaks down what each one of those different lines means. So seasonal water pooling in a crawl space, no, it's totally dry, would be a 0. 1, limited moisture. This is a good example, is this first one right here. Limited moisture can mean different things to different people. Some moisture can be different things to different people. So we've got guidance as we get into that from this kind of reference guide here. So limited moisture is, hey, this soil is moist, the concrete is, there's visual moisture on the wood, no standing water. Some moisture, all of the above, or less than 4 square feet of visual pooling of water on the soil or concrete rocks, limited to one location, no water pooled above the vapor barrier, moist wood is evident, and then major pooling being standing water pooling in the crawl area over a greater, I won't read the whole thing, but you get the idea. This reference point is intended to take at least some of the subjectivity out of this, so you are not guessing what 0 through 3 actually mean. So if you're unfamiliar, or if it's not specific enough, then reference this document, print it out, have it laminated in your truck or something, keep it along with you. And let's pause there for lunch. It is moving farther along, just to remind you, we're kind of in that assessment, healthy homes audit stage of things. So we've talked a little bit about the assessment forms that are either required or like the intake form that the Opportunity Council uses. Now we're going to move on to this idea of like what we actually can do at a job site. And one of the first places to start is like, well, how do we determine what we can do? How do we not justify even quite yet, but how do we know what we're supposed to be able to pull off at a house? And the policy actually gives us a little bit of guidance there. Policy 9.2.1, I'll pull it up real quick, and it reiterates a lot of the stuff that we've already gone over, kind of what the purpose is. So the purpose of the measure we install is reduction of household hazards, prevention of slips, trips, and falls. What is the basis for the program? We talked a little bit about the work plan, or Ross did earlier. Serving homes based on the weatherization manual. We do an assessment with these documents attached to it. And then we have a list of measures that also need to be tied to one of our primary goals, whether it's a household health hazard, medical needs, or well, I guess some of that would be respiratory problems. And then we've also got some training in here. So we do have a beginning point for understanding, like, how do we determine what we can do? We have a policy manual. We need to make sure that we distinguish between weatherization funded measures and healthy homes funded measures. And I think of this specifically because of my own experience installing bath fans in houses. And knowing that, man, I really want to maximize my healthy homes funding. So why don't I just charge all of the bath fans? This gets to a conversation later, but we'll get there. Like, I want to maximize my healthy homes funding. So I don't know, I'll charge both the bath fans to healthy homes. And then I get all of my project notes coming back to me from Kyle saying, that's not how this works. The weatherization program gets to take one of those fans. And if you would like to install another fan with justifiable reason and purpose, then we can talk about that as an additional healthy homes funded measure. So making sure you understand how to distinguish between what is funded and how it is. Make sure you document your rationale. This quote here is directly from our policy manual. The measures we install need to be innocuous, non-toxic, low VOC content, or low VOC emissions. So whatever we install in the house, we don't want to make the house worse just by the installation of it, which is why Glade air fresheners are not on the approved list. And then we also need to, as we are installing or researching what to install, we should be looking for the least toxic product or material feasible to complete the job. That's, again, language that is taken from the policy. There's some interpretation to that I think could exist that's maybe worth talking about. How do we determine the least toxic product without making a single flooring in one room the same amount cost-wise as doing every room in the house with another product that's also low VOC? I don't know, maybe it's worth a conversation. Ross, I'm dipping over into the funding matrix. Do you want to talk about this slide a little bit here? I can make it bigger or smaller too.
It's fine for me.
Okay.
Yeah, I just wanted to note, this is one great place to check in the manual. As you can see, it's Exhibit 6, and it's several pages. One of the issues that pops up here is that you can't see the column headers. And that is a little bit of a pet peeve of mine, is the column headers don't, reset for every new section. So just so you know, where we see all those X's, that column is healthy homes. And I think that column title might be like weatherization plus healthy homes or something like that. But this, I think, illustrates that these measures are uniquely enabled by weatherization plus health funding. As you can see, the only X's are in the intersection between state weatherization plus health, that's the row, and the column of healthy homes. So these are things that you can't use other funding to do. And I think that's just really important to be aware of before you get going on a project is, do you have the budget to do these things that only one funding source will pay for?
Yep. And for reference, if you're pulling up the policy manual and trying to figure out where the heck that is, it's Exhibit 6, but it's also page 546. So if you're following along at home, that's where you would find it. And it does have it has these nice columns right here. This column that Ross was referencing with the check marks in it is healthy homes, is what the title. Actually, you know what? I've got it right here. I don't need to read it on a separate screen. So here's your column right here. No savings to investment ratio, healthy homes, measures, healthy homes, weatherization plus health funding only. Down there. All right. Cool. So within the measures lists, we have kind of two primary listings that exist of measures within the manual right now. And I'm gonna do kind of how it stands right now. And then I'm going to ask Maria to give us just a little bit of a clarification of what is coming in the new policy, and why kind of the adjustment has been made. So that's a little foreshadowing right there. But I'm giving you that because I'm going to go through how the manual reads right now, of what is in what category. In case you go out tomorrow and you have a healthy homes only project, you know what you can install in a house until the new policy manual comes out, and then you'll know here in just a minute what that's all about. So current measures, healthy homes only allows for us to do quite a variety of things at a house. We can do dust mite covers, which needs to be, there's ratings for each one of these things. So 10 microns or less for our dust mite covers. And is there a number of them that we can do per house? I thought for sure I read a number. No? Okay. I think I've been mixing this up with flooring and per rooms all day long. So I'm not surprised that I'm questioning myself now. HEPA vacuum cleaners. We can leave a HEPA vacuum cleaner at the house. It needs to have a HEPA rated filter. The conversation has always been on the lead side of things, is that you can have a HEPA rated filter, but it's not a HEPA rated vacuum. You can have a, just make sure you're getting the right thing. The documentation within the policy says that a HEPA vacuum cleaner needs to have a HEPA rated filter. So keep that in mind. Flooring. We mentioned earlier, you can do up to 2 rooms for new flooring, low VOC, solid surface, or low pile carpet. I hate putting down low pile carpet. I know it exists. I know it's in the policy, but carpet in general, it's still there. That's fine. More than 2 rooms, though, use that overage, that over limit form. As we discussed earlier, there is a section where you can put down additional square feet to justify additional rooms in the house if it is needed. The policy also notes that we should be recycling carpet if we can. If there is a specific location to do such a thing, I probably will not be doing it. I would not encourage a lot of that because of what you're trying to get rid of it for, which is the stuff in the carpet. And I don't want that getting recycled into plastic bottles for whatever, Kirkland's signature water or something like that. And then, so this flooring also includes, this might be what we call ancillary measures, is anything to make sure that that flooring does what it's supposed to do, that it's not only replacing the carpet, but it's also stable, it's secure. Any repairs that need to be done to make sure that that new flooring is installed in such a way that will last, that's kind of part of that process. So again, when you're thinking about budgeting, it's not just, well, it's $2.19 per square foot for this house. If you need flooring repair, that should be part of the budget for that flooring work. If you need to shore things up underneath, if you need to redo some subfloor, that's part of it. We want that flooring to last. Some other healthy homes only, specifically healthy homes only, if you're going that route. Slips, trips, and fall hazard prevention. So ramps, fixing steps, barrier-free showers, handrails, shower mats, soft spots, door widening. Is anybody doing a lot of door widening? I think I've done that once. It was a process. Comprehensive cleaning. A one-time comprehensive cleaning with the idea that it opens up additional work on the house. I do want to ask this one. Does anybody have any experience with comprehensive cleaning? Chris says wheelchair doors. Yeah. Lisa says no. Anybody with comprehensive? What does that entail? Annabelle, great question. Kyle, can I put you on the spot?
Yeah, I was keeping quiet.
It was, yeah,
Um,
I've got stories, but I think you got more.
I mean, we've done the comprehensive cleaning a couple times, and most of that was removing a lot of debris from the exterior of buildings just to keep rodentia away from the home. That's the one or two that I can remember off the top of my head.
Hey, Kyle, if I may, can I ask you a quick question? I was gonna pounce on whoever said they had experience with this as far as like funding and getting it done with. Was that a bid process involved? Was it onboarding involved, or how'd that go?
It's a really good question, Donnie. I believe we had to secure, well, I think we've done it once with, now you're rattling my brain. I think one time we used weatherization contractor to physically move the items into a dumpster that we had put on site. I know that happened a couple times. I want to say we had some sort of newer contractor come and do some cleaning, like I don't know, was it like a Merry Maids or some sort of actual cleaning outfit came in there once, as I recall. But mostly just manual labor from the contractor and working with your local sanitation company to put a dumpster on site.
Yeah. Dawn, I see your hand there. I want to just maybe put a pin in the finding contractors for certain things as part of let's flag that for discussion later. I think, Ross, I just don't want to skip over you there, Matt. Dawn.
Hey, well, when I came here, Pierce County had a contract. We did procure for a green cleaner. And they went to a site and they did clean. We kind of offered them a one-time cleaning. She practiced green cleaning practices, cleaning with vinegar and all the appropriate mixtures and what's allowable under green cleaning. She also, educated the clients on what what she was doing, how she was doing it. And then she also left them with a green cleaning kit that we provided to her under that contract. So that was, as it explains, a one-time, really deep cleaning for the home. And then, but yes, Donnie, that had to, we procure for everything in our program, but that's something we had to go out and find. And before I got here, the team had found someone that was willing to do that, or that was what she did for a living, was cleaning houses, but focusing on green cleaning.
I want to flag the one at the bottom here, this community service delivery partnership. We are going to bring that up a little bit later, but that is also within, if you're following along in the policy, that is also in this healthy homes measures list. But it's got some more specificness to it that I want to bring up later.
Jake, on the comprehensive cleaning, does hoarding fall into that?
Sorry, does what fall into that?
Ordering.
I'm seeing Maria answer the question with her head.
What did she say? I didn't see her.
Sorry, no, we don't address hoarding because that is something that would require like aftercare, some sort of like therapy, or having an ongoing help with the organizer or something like that. So we don't address hoarding because it is a mental condition.
Okay, thank you.
Yeah. That's a great question, Annabelle, because it is a fine line between that one-time cleaning being something that you think could help, and also the fact that it may not help somebody with that mental condition. We had a client here with a similar thing, and it turned out that it wasn't a good fit for a one-time cleaning because it wasn't going to really be helpful in the long run. Dawn says, how do you find cleaners prevailing wage? Okay, I'm going to leave that up there for now. Okay, I'm going to move on. The next category in the policy manual is weatherization plus health measures, which kind of expands our list a little bit as it exists right now, to include some other items. Client education. Louisa says, what about pests? I mean, yes, it's going to make more sense once we hear what the policy will read. So I guess keep that. Spoiler alert, the policy is going to get like combined. So it's just a big list for things. All of these things can be together. That is kind of a spoiler alert. That's all right. We're going to get through it. We're going to come back to pests, Louisa. Weatherization plus health measures, client education, educating them on health and safety concerns in their homes. So a lot of that is providing the documentation you have filled out, the pollution source survey, the client informed consent, the observed conditions, providing them with information about their home. It also includes any documentation about installation of new equipment in the home. If you've got an HVAC, if you've got to put an HRV in the house, if you've got a new bath fan, like what is not just here's the owner's manual, but some amount of education on how to use it. If you were to plop me into a house with the brand new HRV out in the garage and multiple legs going different directions and just gave me the installation manual, that's not a lot of assistance for me to know what the purpose is and how I'm supposed to run it. So some education regarding that new equipment. Dawn made mention of a green cleaning kit. A variety of recipes and things that can be used in order to make a house safer and cleaner, and different cleaning supplies than bleach or Fabuloso or any of those other fun, brightly colored things that you find underneath kitchen sinks. So this is the recipe booklet here. Drain cleaners, oven door cleaners. You'll notice a pretty consistent, pretty low impact ingredients. It's not mixed together these 50 different items. It's just a couple of things. And in reality, it's really like vinegar mixed with something else. is typically what it is. All right, so the green cleaning kit. And then not just like these recipes, but you also might provide some actual cleaning supplies themselves. We have supplied in the past a bucket with some vinegar, baking soda, soap, different cloths and sponges and things that we can leave on site with the homeowner just to kind of just to reinforce or to remind or encourage them to pursue these greener ways of cleaning their house. Chris says, I thought baking soda counter-reacted vinegar. I've heard that too, specifically when it comes to washing fruit, is that you don't want to wash them both in baking soda and vinegar at the same time. So more measures for weatherization plus health. Walk-off doormats. Oh my gosh, here it is. Here's my up to 4. I knew it was in there somewhere. It wasn't rooms, it wasn't dust mite covers. Walk-off doormats, like front, back, interior, exterior. You can have up to 4. Why do you suppose doormats, that's not really a sentence. Why do you think that walk-off doormats are on this list? Yes, Tammy. Dirt carries bacteria. Yeah, it can also carry all sorts of fun things. Jim mentioned lead-based paint earlier. And I've been to houses where the house tests negative for lead-based paint, except for wipe samples on the floor inside the house. And it's because a neighbor was scraping the lead paint off their house. The kids played around in the yard and they tracked it inside the home. Yeah, walk-off mats definitely help. Water equals slipping, says Chris. Yes, indeed it does. Walk-off mats, dry your feet off a little bit. Particulate matter, all sorts of gross things. Little bits and pieces. I've got chickens in our backyard and dog poop in my house. Solid, Tammy. Yes. Yeah. Also, just don't wear shoes inside your house. Take them off outside. That's also a good start. Water heater temperature adjustment. Some of your agencies might do this as part of kind of the pre-audit process. What is the ideal temperature for water in your water heater? 120 degrees. That's right. Way to go, chat. Why do we not want it to go too much below 120 degrees? Okay. CO detector and smoke detector. Removal of toxic chemicals. My wife and I were we were walking through a seafood section of a grocery store last week, and it smelled so heavily of Pine Sol. And I didn't think people used Pine Sol anymore, but it was like you couldn't breathe. There was so much Pine Sol. And then we came back after it had all dried because it smelled really, really bad. And she was like, well, maybe that's why they used Pine Sol, because now it smells like cat urine. I was like, well, maybe they got bigger problems out there. But either way, those sorts of toxic chemicals, no good inside the house. If it's fluorescent, it's probably not really good for you. All right, additional measures. Furnace filters. You can provide 6 disposable or 2 washable furnace filters. And here's where I want to pull up my manual again, because I want to know, I don't remember there being a MERV rating listed. I thought so too, Chris. Chris says MERV 8.
Correct. MERV 8 is the minimum.
Okay. I don't see that listed under furnace filters.
It's somewhere else in the
Okay.
as the manual, but yeah, it does exist somewhere in there.
Okay. Higher than 13 is HEPA. Yeah, so furnace filters, 6 disposable, 2 washable. Pest mitigation. Louisa was asking about this. So pest mitigation. What goes into pest mitigation? Anybody want to take a stab? If you've used pest mitigation before, what are we talking about when we're talking about pest mitigation? It's probably not just putting out traps. Nate says toxic chemicals. Air sealing.
I have one from a while back. She had bats, and well, we had to wait. There's all kinds of rules around bats, but essentially, we were able to link it, through respiratory illness, and that included well, she had like a R12 of bat poop in her attic, right? And so we vacuumed that out, did air sealing, screening, et cetera, and so it was a lot of what you would see as maybe pest exclusion, just through an actual certified pest control person.
Yeah.
So it was a lot of the same, but we just were able to use the funding for that and able to do it before the actual weatherization, since it was prohibiting us from doing anything.
So in your case, it was a lot of like prevention type of stuff. It was locating access points, eliminating access points, air sealing pathways between the house and the area where it was affected. Yeah. What else can go into pest mitigation?
So I'm thinking, would it be like treatment of, let's say, the roaches, like a three-time treatment of pest mitigation?
That's
I
a
don't
good
know. I'm not
question.
quite sure. That's why I asked about pest mitigation.
Yeah,
I do have a few homes with roaches, and I want to see if anyone else has worked around that.
Yeah, Maria, you want to jump in on that happy note?
Actually, it wasn't about a roach infestation in particular, but we actually had a case a couple of years ago where the agency got permission, but they had to actually rehome the client for a while they addressed the issue because it wasn't safe for them to be in the home while they were taking care of it. And so they had to put them in a hotel, and it was a whole thing, and they were able to do it. But sometimes in extreme cases that can be allowable. Just work with us here at Commerce and we can get that for you. As far as roaches, I would assume it would be, you said 3 treatments. That would make sense to me to make sure they're actually eradicated and we're not just, putting a Band-Aid on a huge open wound, there's definitely things that need to happen there.
Yeah. I think maybe the long and the short of it, Louisa, would be as you have ideas for treating pests like that in specific, run them past the Commerce folks. The BPC is always willing to chat about options. We've worked with integrated pest management companies before too, where their job is to look at not just a one-time treatment, but how do we treat kind of the initial gross of the situation and how can we maintain it going forward. The problem that we've run into, at least in my experience, and it's been a little while, was that we can't perpetually pay for integrated pest management. That's repeated visits out to a house to either treat or to address the problem continually over the course of many years. And at some point, the funding does not exist as a continual open pocket, feel free to just keep paying for it. So I remember having a few clients where they had major rat and rodent problems. And after a year, we got an approval for a certain chunk of time for this integrated pest management. It ran out. And the client needed to know when it was running out so they could plan. And the contractor needed to know when it was running out so they didn't continue going out there and then just arbitrarily charge the client for something that they hadn't continued to agree to. So again, as you have ideas, run them past some folks, whether it's Commerce, whether it's us, whether it's another agency that may have worked with that type of situation. All right, so pest mitigation, mold and moisture reduction. And you'll see a variety of things on here because there's a lot of different things that you could bring up, whether it's dehumidifier, dehumidistats on different things, leak repairs, sump pump installations, drainage system, mold remediation, ground cover. You'll notice that it doesn't necessarily say spraying bleach on the roof deck of a home from the attic. It's not, we don't want to try and treat something that's affecting the indoor air quality with something that will affect the indoor air quality. So this is another one to reach out and ask more questions. I don't like the idea of just slapping a dehumidifier in a house, but there might be a good occasion where that makes the most sense for the tightness of the house, for the location of the bath fan, and the potential for moisture in certain areas of the home. Maria says, hygrometer is being added back to this section. Not sure when it disappeared. Awesome. Okay, I'm gonna go to the next one. More mechanical ventilation, exhaust or supply, ERV or HRV, or another advanced system. Anytime there's an other, assume that is your location that is your chance to ask more questions. Not come up with another advanced solution and then do it. Ask questions first. There are great solutions out there. Make sure that everybody's on board. Limited roof repair, limited plumbing repair, gutter and downspout installation, HVAC cleaning, air filters. Maybe this is where the air filters / furnace filters, where we've got our MERV 8, and it says that you can provide 2 years, up to 2 years worth of replacement filters. Should cause you to ask questions like, well, how often should it be replaced in an ideal condition? And if I'm not installing something that needs an air filter in an ideal condition, how many do I actually need for this house? So keep that in mind as you plan. The last one in this section is an air purifier. And I remember having a long TDC conversation about this back in the day, about whether we recommend specific brands, and we all decided, no, we don't want to do that. It needs to be HEPA rated. The filtration system is to remove particulate matter only. There we go. And then it is not allowed to have ionizers, UVC light, or other ozone changing systems. My space bar was not working. There we go. So no ozone related filtration systems in the house. I don't want to walk in and have your house smell like mothballs and say that you got a good deal on something. Please do not do that. That's bad in a variety of ways. Before we move on to another slide, I do see a couple comments I want to get to. Matt says, we always get hung up on the policy that says, if you can use normal weatherization funds for the work, it must be used first and then healthy homes second with ventilation improvements. I would like to pick on Kyle again, if you're around.
Yes, I am.
Sweet. Can you talk about how the OC weatherization department kind of works with that policy language?
I think we stick pretty true to that. If we're doing more than one fan, I guess you'd say, or if it's an ERV or HRV, which we don't do that often, we pay for the first one of them with weatherization and the second one with healthy homes. More or less.
Fair enough. Matt, is that, I don't feel like that's necessarily an answer. That's our way of doing it. Do you want to add any more to your question there? Or is it just as kind of straightforward as I'm reading it?
Yeah, no worries. I mean, the only issue that we have is, we'll plan to spend funding using healthy homes, and advanced ventilation is one of those things. But now that the ERV and HRV and balanced ventilation is being added into the policy for everything, it just seems like that's one of those cases where when we do have a need for advanced ventilation, does that still meet the requirement if the need means replacing that fan to like meet ASHRAE or something? Like even in some homes, you might have to replace 3 bath fans just to meet the ASHRAE requirements, and then you can't use any of them for Plus Health. So you're kind of losing out on being able to apply that additional funding for it, which we are obligated to do from the Department of Commerce to spend a certain amount, or at least allocate a certain amount for Plus Health. So.
Yeah, that's a great question, because we do run into those houses where we need more than a single ventilation system to address typical weatherization, but we also are being asked to spend down our Healthy Homes available funding. Maybe let's hold on to that one. I would suggest, based on I don't know about experience, but just anytime you've got like, hey, I'd like to put this to this funding source, asking some of those at Commerce, maybe they'll be like, oh yeah, no, put that third fan to Healthy Homes. That makes sense. Or no, please don't, Michael says filtration versus purification. And I don't remember how we landed on leaving the purifier name in there. I think it's just because it's a typical label for what those systems are. If you Google air filtration system, you get a whole like separate sort of MERV 13 filters for furnaces, as opposed to something like this where it's more of a room-based filtration system. All right, I'm going to move on. And at this point, we have a new list or a tentative subject to approval new list of allowable Healthy Homes measures. And as I pull it up, Maria, would you mind kind of going over what you sent me in that email earlier today?
Yeah, absolutely. Thank you. So there's been, for as long as I've been program manager, some confusion around the allowable Healthy Homes measures versus weatherization plus health umbrella. And so after some digging, we found that all of these measures actually did at some point live under the Healthy Homes allowable measures, but when there was a funding cut, they were then removed instead of, changing the cost cap. Some decisions were made, a lot of confusion went around. There's still, I think, confusion among some agencies who are using the full list instead of those set 6 that we went over just a minute ago. And so what I've been working on is adding all of those measures back to allowable Healthy Homes. They'll still be allowable under weatherization measures, health and safety, and related repair measures, as in addition if you wanted to use other funding sources, but they will also be allowable under Healthy Homes. And so hopefully that takes away some of that confusion. I'm doing a huge overhaul on the weatherization plus health policy. It was, I believe, 4 different policies within the manual, some of those provisional measures for fuel switch and deferrals. So combining all of that, doing away with a lot of the redundancies that we're seeing, and a few additions as well. So really excited to get that out for the next manual release. All of that work has been completed and is now with the PDC, so they'll be meeting on that really soon. But yeah, all of these now will again be allowable under the Healthy Homes measure. So I'm happy about that. That should help with spending, right?
And so just to make sure, just to sum it back up, the categories that, up here we had in the policy manual, it says Healthy Homes only. And then there's a section where it says WX plus health measures. It's basically like we're just taking the headings off of all of these, and the list of approved measures goes for both, all of that together. Okay, that's great. Because I was looking at this and going, wait a second, they're like almost all exactly the same. I think they might be exactly the same.
Yeah.
And so as it stands right now, the policy right now, before it is changed, still has that differentiation. The policy, as it will be when it's updated, will have them all lumped together, allowing for both sides of the program, the Healthy Homes only and weatherization plus health, to be used.
And just to throw a plug out there, since I have everybody on this call, thanks for everybody for showing up too. I'm really excited to see so many people here. But if there are other policy updates that you would like to see, I've been taking notes as Ross has been saying a few things throughout this workshop. But if there are ideas, I always encourage folks to send me an email, give me a call, let me know what you'd like to see spelled out or additions, there's always more that we can do. So love hearing from you. Let me know. Thanks.
Thanks, Maria. Yeah, so you'll notice that these measure lists are pretty much the same. I won't read them all because they are the same. We've got the same list here. I would like to flag that word for a question. Are we good with the word abatement? Maybe that's a discussion later. Abatement is like a scary word when it comes to lead stuff because it bumps us into a different category of liability and responsibility. So I just want to toss that out there.
Jake, are you proposing mitigation?
I would prefer mitigation.
Remediation? I think that's what we've been
Remediation works,
referring
yeah.
to. Okay.
Yeah.
I think that's what, okay, I'll look at that.
Yeah, I think remediation might be what is, yeah. Yeah, currently exists as remediation. Area fills up here. Cool. Yeah, all right. Okay. It's about 16 minutes till another break, in case you were wondering. Couple things I wanted to dive just a little teeny bit deeper on is a few of these individual measures themselves. We talked about client education needing that basic health and safety education component, where it's the client education guide, client health and safety observed conditions, referencing the keep it principles, the client guide. I have did I pull that up here? Had the guide. All right, I want to pull up the guide just so you can kind of see what it actually is that we're looking at here. What's that? Just make sure that your clients have a copy of this one way or another. We'll go with that. That's this document right here. Standardized educational content. It's good stuff. It's not the most exciting document ever. It comes and it discusses keep it principles, efficiency. It's client education that's beyond just health and safety material. All right. One of the things that we skipped over way back during the Healthy Homes Only section was this idea of a community service delivery partnership. Ross, would you be, I know that you dropped the slide in, you might be more familiar with some of the language in the policy on this. Would you mind talking a little bit about this portion of things?
Yeah. I think the first thing I want to say is it's very clear in the policy that this is not required. And I think it's important for people to be clear on that. Agencies have dabbled in healthcare provider partnerships, and there can be benefits, but it's absolutely not something that you have to treat as essential to be able to do Healthy Homes work. And are there any Healthy Homes measures, upgrades to the home that require having one of these partnerships? I think the answer is no. So not having one of these partnerships should not be something that limits you. And personal recommendation, if you consider this to be sort of an advanced mode approach. You're not required to do it. It probably doesn't make sense for any agency who feels like they don't have a lot of experience with this work. I would say put this thing off for later, maybe, and maybe don't. I think we could have a discussion about kind of what are the potential benefits of engaging. First thing that comes to mind is having, the possibility of a referral pipeline. And just coming from my experience in energy efficiency, if I know that a home is a high energy user, I'm excited about getting to do work on that home because there's a lot of potential savings there. And I think the same is true. If you have a healthcare provider who's like, this person has acute illness and their home is a culprit, it'd be great to be able to help that person based on, as opposed to just sort of whoever comes in the door and then we ask the question, they're like, sure, we have some asthma, So I think there's value, but I would say just treat this as advanced mode. That's my recommendation.
Yeah, I think that there's I like your example of going to a house where you know that there's really well-documented known energy reductions that we can find. And this feels like a similar thing that's down the road, where when you know that there's a documentable health concern with repeated hospital visits and whatnot, it also feels like it's that next advanced step of how do we document more of this? How do we find out more? This is the sort of data and data collection that is so helpful when it comes to time to re-up contracts, to promote our programs on state and federal levels, to be able to share kind of what we've done. And more than just anecdotal. Anecdotal is great. And I have a handful that I keep in my pocket of situations where we were told that, you know, they were going to the hospital once a month or whatever, and now they haven't for the last year. And those are amazing, but to have more documentable information is amazing. But advanced mode. All right. A few more specifics about the actual measures themselves, safety and mobility items, barrier-free showers. Has somebody, I feel like I was talking with somebody recently who was dealing with a shower install. Was that us? Yeah. Kyle?
I think so.
Yeah.
We have something in the works right now.
Yeah. I mean, it's not going to be on every job that you put in a barrier-free shower type setup. Those are significant improvements, and making sure that they're compliant ADA and whatnot is a big deal as well. We mentioned flooring repairs and soft spot as a part of the flooring package, so keep that in mind. Some of these I just wanted to show crazy pictures. Environmental health, pest mitigation, removing toxic chemicals, green cleaning kits. The removal of toxic chemicals from the house also can bring to light other things that have been hidden, specifically underneath where they were storing the toxic chemicals, because those are typically like garages, hallway closets, under kitchen sinks, under bathroom sinks. And once those are exposed, you're like, oh no, there's other things going on that are competing for the interest of your lungs. So making sure those things get removed. All right, let's talk contractors. Because the crew-based world is dwindling in the weatherization assistance program, I think statewide. There's not a lot of crew-based agencies left out there. Doesn't mean that there aren't, but what it does mean is that we are going to be asking contractors for some pretty specific work. And sometimes it's work that they aren't trained to do. So somebody brought up prevailing wage. Who was that? I'm not going to search it out, but if you have an existing, let's start with existing weatherization contractors. If you have an existing weatherization contractor and you are unable to find someone that exists in the contractor world that is willing to do prevailing wage and whatnot for the specific item you're looking for, your best starting point is to talk to your weatherization contractor. Hey, weatherization contractor A, have you ever thought about doing flooring? Would you ever think about doing flooring? Because it's a lot easier to get them on board, perhaps, with doing an extra measure than it is to try to get whatever Ralph's Floors up in Linden to learn how to do prevailing wage so that we can get them out onto a job site. So start with reaching out to your existing contractors. Outside of that, oh, it was Matt that asked it. How do you find cleaners who do prevailing wage? That is a great question. The next question is, you might have to reach out to a contractor because they come highly recommended, or they do what you are asking to be done in the right way, and you might have to provide support. in order to bring them on board. I mean, you hear from a lot of the weatherization contracting world that yes, there's extra paperwork, but we charge you for it. Whether it's prevailing wages, it's intent and affidavit, whatever, those additional costs get rolled into invoices or I guess I didn't have anywhere else I was going with that statement, but if they're given additional information on how to provide that service and how to provide the paperwork, then they've got an additional work source. And if we have money to spend, most contractors, if they're given assistance, will go, oh, this might be a way to get into this whole program. And I can be a reference point for, I can be a contractor that works in the area. I'm thinking of one of our weatherization contractors up here. We wanted to have somebody else that could do wood stove installations. So we said, well, do you mind figuring this out? And he's like, yeah, sure, we'll figure it out. A couple weeks later, came back and said, oh, yeah, let's talk. Let's see if we can get out and do some more wood stove installations. Ask the questions and then be willing to provide some assistance. If you are not the prevailing wage person at your agency, I don't want to just volunteer our staff for providing prevailing wage guidance for contractors throughout the state, but there are good resources for how to fill out paperwork, for how to make sure you're following all the rules. So look for contractors that fit the bill. If they don't, reach out to your existing contractors that you work with. If they don't want to, look for a sole proprietor, look for an existing contractor that may be willing to pursue additional work. Nate says, have those who have done cleaning, pest mitigation, or other healthy homes measures that don't have a specific prevailing wage just paid labor rate for that work? Nate, I'm going to try and reword your question. Are you asking, are you paying a laborer, just a general laborer wage for measures that don't have specific prevailing wage rates?
Yeah, I mean, I'm assuming, like when we do flooring, that falls into carpentry. So even though it's a healthy homes rate, we know that that's a carpentry rate, or if we're doing plumbing repair, whatever. But there is no prevailing wage, obviously. I mean, this has been an age-old issue, but have people had experience, I guess, with that? Paying a cleaning company, just assuming you can find a company who will do prevailing wage, would laborer be the appropriate wage rate to pay, I guess would be my question.
Kyle White says correct, as he recalls. Anybody else want to weigh in on this one?
From what I recall, it's been a few years since we did that pest thing, but I want to say it was just whatever they needed us, and we were able to do it as a specialty thing, so there wasn't really an onboarding thing as far as that goes either.
Yeah, sorry, somebody else. It's not easy. The support that we are asking contractors to step out of their comfort zone, perhaps, and to not only take on work at a less than stellar environment on occasion, if they're replacing nasty flooring, let's say, but then to do additional paperwork. If you have the capacity at your agency, if you have an administrative staff that deals with the prevailing wage, check in and see if there's any sort of assistance that can be provided. Where the goal is that we have contractors that we can use. So reducing any sort of administrative barriers for those contractors is definitely helpful. And then the last one here, ensure understanding of the healthy home scope. I can say from personal experience, if you provide very general direction, you will get very general work. So if you want a certain VOC, below this VOC type of flooring that is installed in this area with this transition from this room to this room, you need to spell it out. So making sure that the scope of work, whether it's a weatherization contractor or a specialty contractor, make sure that it is as spelled out as possible, especially for the specialty contractors, because they are not as familiar with the program. And that would be not adding just an administrative burden, but an actual like occupational burden to try and figure out what you mean. So make sure that everybody understands what the scope of work actually is. And we got 1 minute, which is perfect because I'm going to go over this one. Inspections. These projects need to follow standard weatherization inspection protocols, which means somebody's going to come out and look at them. A qualified person is going to come out and look at those jobs. They ensure that measures meet the specs. It means that your QCI needs to know what MERV filter rating he's expecting or she is expecting to look at for that filtration system. It means that they need to know what VOCs the flooring is so that when they walk in and smell a funky glue smell in the house, that they're able to understand, like, what are we actually dealing with here? So they're out doing the exact same things as they would for regular weatherization. And they're also going to make sure that all of our documents are complete. The client education information stuff, the self-attestation form, the self-declaration form. All right, our last section is about reporting, which actually, as it turns out, is not terrifically difficult. It's dropping the right thing in the right place. Reporting, however, does require proper documentation. Again, it's just something we've said multiple times. Make sure that it follows all standard weatherization documenting rules. Take lots of photos, show your justification and documentation. If you need an additional form to justify going over a certain dollar amount or installing extra flooring in a house, make sure that that is documented. If you need to know what goes into a file like that, you should look at policy 5.1.2, which provides a very handy list on what goes into your weatherization file, whether it is your weatherization related repairs, weatherization measures, health and safety measures, measures that you are not going to install that would normally be installed on a house and why. Justification, client eligibility, and on and on and on. Make sure you maintain that project file, that as it gets to its end, that it is tied up like a real nice book, that it finishes and closes out and is complete. Places where we enter in information include WIDs. There's not a lot of instruction that I think really needs to go into WIDs because it is a, yes, I installed this thing and then whatever unit of measure it is. You don't need me to tell you how to enter stuff into WIDs because if you have a weatherization plus health project, you enter in, yes, I did client education and I did one of them. And wherever it relates to your project, you enter in that data into WIDs.
Hey, Jake.
Hey, Kyle.
I think with WIDs too, I think there's a spot on there. There's a first tab in WIDs. It's called maybe the project detail tab in WIDs. And there is a section there to click comprehensive, standalone. Oh, you have the choice to pick one of those. Like I think there's 2 or 3 answers.
Okay. That is helpful. Will, based on, do you know if whether you click that or not, does it open this section here? Does it allow you to put stuff in only if you click on one of those, either comprehensive or standalone?
I do not know.
Okay. All right, so we got WIDs. We also have, let me readjust this real quick. No, it does not, says Louisa. Okay. You just click it. All right. So you can enter in stuff in here regardless of whether you've clicked comprehensive or standalone. Yeah. Cost allocation, making sure measures are charged to correct funding sources. Here goes to your fan split situation. One fan goes one direction, a second fan goes another direction. Make sure you document them clearly. And this again is probably another, this is something I'm not as familiar with. I actually had Kyle pull a picture of this out so that I could see what it actually looked like. Here's your cost allocation or your budget table in CMS, and just making sure that you drop the amount you are requesting in the appropriate budget category. This goes for a variety of things, does it not? Your timesheet, you don't want to accidentally put 2 hours to the wrong timesheet line. Similarly here, if you're spending the mark of the beast number of dollars on healthy homes, I mean $6,666, you don't want that to get dropped into weatherization readiness by accident because there's different dollar amounts. So making sure that data entry is correct and accurate is super important. Kyle, anything else you want to add to the entry line here?
No, you just want to make sure you get, I mean, if you're charging flooring $5,000 to Healthy Homes, you just want to make sure that information gets to whoever does the A19s. And everybody probably has different ways of doing that.
Yes. We'd love to share with you what we do here, but actually we wouldn't really, because it's complicated and our fiscal staff is not available right now. That's kind of the end of what I've got. We are at questions time. We knew that reporting wasn't going to take very long. We've got about 45 more minutes worth of our time. Ross, do you want to lead some of the discussion time here since you got the topics laid down?
I'd be happy to. So yeah, I pasted a list of 7 topics in the chat, and feel free to add in the chat if you have something you want to hear some discussion of and you don't see it on the list. Feel free to add that. I'm going to just jump in and start going down the list. So one thing that came up, I heard from a couple of people that there can be challenges having that conversation with clients about their health conditions. And just want to put it out to the group here. Are there any strategies or approaches that you employ at your agency for having this conversation in a delicate way, for explaining why it's relevant when, you know, people may think they're participating in an energy program? Why are you asking me about this stuff? So I think that more than anything, I just want to flag that this is an important consideration. So I recommend that people figure out how they want to approach this conversation, how to frame it, how to explain that it might be possible for us to provide additional home upgrades depending on this, and you could see some benefits in terms of hazard reductions in the home. So that'd be my recommendation. I don't have specific wording, but that's my recommendation there.
One thing that I have a question, it was kind of addressed earlier, but we know we're trying to bring in more healthy home clients, but we're also trying to determine the best way to do that in a way that we're not doing quantity over quality, i.e. bringing in people who, because they don't have to provide any kind of documentation, you know, so we don't have just a plethora of healthy homes intake in regard to, I cough, or, I don't know if I'm not saying it right, but how to weed out the actual ones with the actual health concerns as opposed to people who just want us to come into their home and fix their house.
Yeah, I think, there's a need to be discerning. I think that's really important. And I see Michael mentioned simply asking the question on the self-declaration. I think that's good recommendation, that we don't want to, that maybe there's a balance there. We don't want to dig too deep, but we also do want to get enough information where we can make a kind of informed judgment about whether this client was a good match for the funding that's available.
It sounds like it's more likely going to be determined at the audit anyway.
I think there's something to be said for the the human touch. I think it's easy to either just read the questions or go too deep, and pretty soon you're in a, you're at an 8-hour audit and you're the godparent of the child in the house by the time you leave. And I think there needs to be a middle ground other than just reading a question, but also not going too deep. I think there's space for saying, just being that person alongside, like, hey, I've got dogs in my house, and here's what's happened with how often do you have to sweep? I can't even believe that my golden lab is shedding all over everywhere right now, and that can open a conversation a little bit farther. So there's different elements, and it's hard to quantify. It's hard to put into actual language what exactly I'm getting to, but I guess just to throw it out from my perspective, that the personal element, I think, is important to try and dialing in some of those things.
That's a tough one as well in the intake side, because you have just as little time, unfortunately, to kind of send people through the process as the auditors. I mean, you've got stacks and stacks of intake to do, and you can't have 2-hour conversations with all the clients regarding all the different reasons they may need this, that, or the other thing.
Yep.
Okay, I'm going to move on to question number 2, and I'm actually going to combine it with topic number 4. So scenarios where there are hazards in the home that are real, but they don't have implications for slips, trips, or falls, or respiratory issues, indoor air quality. So that's one area, because I think that there's work that we want to do to address hazards, and it's not always in those clear-cut categories. And then secondarily, when there are hazards, but we don't have, and I think this is very related, that's why I want to combine these, we don't actually have somebody having respiratory issues on the self-declaration, and we also don't have somebody who's vulnerable to falls. So if we don't have either of those, but we do see serious hazards in the home, does anyone have examples from their experience, even if it's a project or a house that you couldn't do healthy homes work on, but you wish you could? Any examples that fall outside of the indoor air quality and the fall hazards, but are still worthy to address? What comes to mind for people? While we're waiting, I thought of something. And Maria, I'd love to hear if you have some opinions on how to approach this type of thing. But we've run into homes where they don't have a working hot water heater. So they don't have hot water. And so let's say we combine that with also a severe rodent infestation, but no documented respiratory issues, no fall vulnerability. How would you want to look at that in terms of whether healthy homes is appropriate? Any thoughts there?
I think that's part of maybe the client education piece, just, informing them like, hey, we noticed there was some sign of rodents in the home. It can lead to these kinds of respiratory illnesses, making sure that we, mitigate, all of the droppings and the rodent problem. Like, this is what we would like to see, what we'd like to do for you in your home, and just addressing them that way, and educating them, not just like, oh, I see you've got a bunch of, mice running around, they might feel, from what I understand, like I've only been on one site visit so far. So, but just, they could take that person like, oh, are you saying like I'm unclean, or, yeah, I've been trying to address it, but knowing the educational piece of like what actually how that affects their health, I think is really important. And so, just sharing that information, like, oh, I noticed this can contribute to this.
Yeah.
This is what we would like to do.
In that scenario, if they don't have hot water, and so there's kind of this inability to do adequate cleaning, bathing,
Right.
hand washing, etc. Would you consider that, like, at least on a case-by-case pre-approval basis, is that a potential healthy homes measure to put in a hot water system?
A hot water heater.
Yeah.
Gosh, I feel like yeah, I feel like that should be on the list. I'm gonna write this down and
Yeah,
see
and
what
it,
we
it,
can do
it
about that,
doesn't come
because
up
that
all the
definitely
time,
makes, right, yeah, that
but we do
definitely.
see it where
Mhm.
some people are just like, oh yeah, haven't had hot water in a year, and you're like,
Yeah,
oh my
how are you
gosh, that
expected to
seems
keep things
like
clean?
way
Yes,
more of an urgent priority than anything else we're gonna do here,
100%. Okay. Yeah.
Okay, so I'm
Yeah.
gonna jump to a few things that popped in the chat, and then I'm gonna get to you, Nate. Um, Marie mentioned hoarding is a big problem here. Same.
Mm-hmm.
Again, that's a difficult one to solve because there's sort of an ongoing layer of attention that we might not be able to bring in order to actually address it. Um, Healthy homes for removing wood stoves is something Matthew Bell recommended. That's an interesting one. Uh, any thoughts on that, Maria?
I actually just had that question at the intake that I was on, because they had one that was cracked and it was just sitting in the corner, and I asked about removal and they said they didn't do that. And so that is a question I did bring back to my team. It's something that we're discussing right now, actually. So that is on our radar.
Nate, did you have something?
Yeah, I wanted to just give a +1 to that thought, Ross, about the water heater. I mean, that we have a client right now who, for various reasons, is going to be really tricky, even with like HRGP and all these other programs, to do work on his home because there's so many problems. But what he really just needs is a water heater. And I mean, I feel like we do run into that, and that is such a healthy homes kind of, at such a basic level. It's a healthy human thing. And so that, I think that would be awesome to have that as a, especially since we can do healthy homes as a standalone thing, because sometimes that's just the thing that is needed. And maybe we'd go back with weatherization, after, but we have a hard time oftentimes doing emergency water heater kind of stuff. So that could, if that could be added, that would be amazing. But I also was going to just, I think the conversation about existing, like, are we only treating existing health issues? I really feel like that shouldn't be where we're at. I mean, we all know, like, the ounce of prevention is worth a pound of cure sort of thing. And we know that bare subfloor in a house that's nasty and filthy and unwashable is bad. So if we run across that, it seems like it would be really helpful to be able to add that in without having already somebody being sick from bad indoor air quality. So yeah, but I'm not sure how you exactly balance that, because I think we also still want to be prioritizing going out to homes where we know that people do already have, kids with asthma or things like that. So
No, that's a great point, Nate. Thank you. This is actually something I've brought up a few times with Laura. She's my supervisor, but there's some reasoning behind it. I don't know if it's in the RCW, the language. I'm gonna look into it a little bit more, as I'm right there with you. Like, if we see something that's, potentially, causing harm, even though they might not have, a visible, or known illness, can't we do something about that? Everybody deserves to live in a healthy home. And so I'm right there with you, but I'll look more into that as well. Thank you.
Yeah, and in that case, there might just be some threshold that we're applying where the hazards in the home are severe enough that it doesn't matter whether people are already sick or already injured from it. So yeah, I think there's some
Yeah, I mean,
potential there.
I agree, Ross. I mean, we make, judgment calls all the time, and I think, we always just say document it. And so if there was some latitude for auditor inspectors while they're at the home to make that kind of call, I think that would be pretty reasonable.
Yeah. Okay, I noted in the chat, Donnie added about a client who was in a clinical trial and their medication needed to be kept warm or at least heated up. And so there
To
was,
activate it, it had to hit a certain temperature. Yeah.
okay. Yeah. So, and that, I want to connect that to, there are a lot of people who have medical assistive devices that require power to the home. And if there's a power outage, they might not have that life-saving support that they need or life-preserving. And so just kind of expanding the scope of healthy homes. Is there ever a case for battery backup or generators or something that can automatically step in as the plan B for providing power to that equipment, including like refrigerators that are keeping medication from expiring. And then, yeah, this is I think that ties in well to what you're talking about here.
And that's a great tie-in to the removing of wood stoves comment as well. I'm thinking about our our own area where we have a wood smoke reduction program where part of it is to, encourage the removal or lack of or less usage of wood stoves. But part of the outflow of that is that it's in an area that often loses power and can be sometimes without power for multiple days at a time. And so it really is like it's not the most out of the ordinary situation to find.
I was just going to mention, just because not all of this is laid out in the manual doesn't mean we can't do these exceptions. Again, contacting Commerce. Lots of times we have these one-off scenarios where people come to us and just say, hey, have this client, has this need. We're able to talk about it amongst ourselves at our tech talks and give an answer. And we always try to get to yes. So anytime these one-offs do come up, please, send them our way.
Yeah,
whether
thanks
it's
for
in questions inbox. Yeah, it's great.
that's helpful. And I think, one of the big takeaways from this portion of our discussion is that just because it's not, one of the just because it's not on the basic list, that probably means you need to ask, but it definitely means you should ask.
Yeah.
So do that. Couple other things here. I like that Michael mentioned solar power and battery backup for healthy homes. So if you're going to do the battery, can we integrate some kind of energy efficiency or energy saving component? And then, I mean, there is there are areas where you have a higher level of power disruption. That should be something we take into consideration. Okay, I'm going to move on to a next discussion topic. This one I'm calling Deep Dive on Fall Prevention. And one thing that I have been learning more and more about is how impactful a fall can be on the quality of life of especially older individuals. One thing that can happen is if you suddenly have a big reduction in mobility because you break a hip, you no longer can exercise to the extent that you have been able to. You might be homebound and become more socially isolated. You might not be able to perform the basic tasks to take care of your other basic needs. And the list goes on, but it's a major impact for the people who survive that. It can be the beginning of a serious decline. And so I think this is a great one that we already have the ability to address. The question I wanted to put out to the group, because I think this is something we're going to have to be asking ourselves. It's in the declaration. What makes somebody vulnerable to a fall? What are some health conditions or symptoms of health conditions that are relevant to this. And people can just throw stuff in the chat or speak up on the mic. Any thoughts on the types of things that you might be looking for?
Something that we're adding to that list actually for this rollout is toilets, raised toilets. Somebody who has some sort of mobility issue of getting up and down can be,
Yeah,
something. So that's one thing that we're
definitely.
working on.
Okay, any health symptoms or conditions that you would say increases somebody's risk of a fall? The need for full-time oxygen use? Recent surgery, Parkinson's, vertigo?
Just any sort of degenerative disease.
Cats? I'm calling cats a health condition too, yeah. That's good. Blindness, okay, you're getting to some of the stuff that were on the things that were on my list. Amputee, elderly living alone. Yeah. Okay, I'm gonna add to that. I made a list for myself earlier. There are health conditions that can cause balance issues, right? There are health conditions that can cause loss of strength and or loss of mobility. So you just don't have the same range of motion that you used to have. I think the amputee thing is disability. Blood pressure conditions can cause people to fall. Side effects from medications. So then there's all kinds of health conditions where the medication can become the risk. Add that I'm going to read off a few things we have here. Strokes.
I come up with hard of hearing or deaf.
Yeah, right. That can
That
affect
throws your balance totally off.
Yeah, okay, yeah. And we talked about vision impairment, so
Right.
sensory impairments in general. Substance abuse and substance abuse with interactions with, medicine too. Dementia is another one. I think somebody put diabetes. Having a kind of a loss of sensation in your limbs can be a major factor and can affect balance as well. Peripheral neuropathy, I think we're talking about, that could be sensations and balance issues. One thing that I noted was incontinence. So people rushing to get to the bathroom, just rushing can be hazardous. Diabetic, having low blood sugar, that can impair your balance and ability to perform basic movements. Great. So just the reason I wanted to go through this exercise was just to kind of paint the picture of think of elderly folks, a lot of them probably have a good number of the things that we've listed here. And so a lot of people are vulnerable simply by age, if not for other reasons. Okay, so we've talked about health conditions. Can we maybe make a quick list as well of measures in the home related to slips, trips, and falls, things people have done? And, feel free to use this list of health conditions. So it's like somebody has a visual impairment. Maybe one of the measures is lighting. We don't often think of that, but lighting can make a huge difference. What else?
I am actually adding lighting, outdoor lighting, to entryways, by the way.
Great.
I believe I've used Healthy Homes with the approval through Commerce to do outdoor lighting before. A lot of these questions, if you just go to WXQ and you have good, clear communication on what you're trying to accomplish and how whatever you're proposing would help, they're pretty flexible.
Yeah, thank you, Donnie. I see Michael put in carpet stretching or removal, and I think it came up earlier, just sort of like flooring transitions in general from one type of flooring to another type, making sure that you don't have a big step there so that you can trip over. Eric put in alcohol. I think that's back to the kind of the health conditions thing. that can increase risk. Installing a walk-in shower in place of a tub, Ashley put in there. Other slips, trips, and falls measures people have installed or are looking at.
When you're during your audit and you see somebody that's always using a wall to follow you around. So hallways should be on a handrail list because hallways gather kids' toys or the cat or dog, but people, a handrail, they just shuffle down the thing. So we have installed a couple of those, and you can buy a handrail up to 24 feet long if your hardware store has a cut by the link.
Yeah. Yeah, that's great. And grab railings and grab bars in general. I like it. I think there was another, well, ramps has come up in the discussion earlier today.
The other thing is it goes back to the lighting. So always they have the adjustable LEDs now for different light spectrum. So we've noticed with people with macular degeneration or they wear glasses is put the couple light bulbs in and then change the light frequency on it, and they will instantly tell you which one they can see better with, and then just set all the light bulbs to that. There's just a little piece on the bottom. It looks like it has a little slot. You put your thumbnail in it and turn it to the arrow. Really helpful for elderly folks, we've noticed.
Chris, do you know what color temperature tends to be better for people with that condition?
It seems like it's in the 1500 light range. It's weird because some people, yeah, and if I ask them, can you read that? No, and I just change the light bulb.
Yeah. Great. Let's see, I thought of another one.
I actually thought of one too. We had a client we did a DHP install for, and she was in a wet area, so we had to do a wall mount outside unit. And she had, and I always ask Ashley because I always forget what it's called, something like mass or something like that. But essentially what it is she's either sensitive to light or vibrations, frequencies. And so the vibration from that unit being on the wall, which was a part of her, like living room wall, and she's in a small home, was an issue, as well as the reflection from the range hood that we installed was, I think, a stainless steel initially, and then we had to go through and make that black. So things like that. And we had the health and safety money from utility to help with that, but healthy homes would be nice.
Yeah, those are good considerations. I see Eric mentioned a lifting lounge chair, and that's kind of along the lines of my question is like, is it ever appropriate to provide a walker using these funds? Maybe somebody's graduated to needing a walker for the first time and doesn't have one, so it'd be nice if we could get one in there before a fall occurs. Okay, I think I'm going to move on to the next discussion topic. And that one is, what are the benefits of partnering with a healthcare provider or a community health worker? Is there anyone on the call who has experience working with these kind of professionals in your program? Internal to your agency, external partners, contractual relationships?
We actually have one caseworker at a facility here that has actually stepped in to help processing of the weatherization paperwork with the applicant. But they're like their social caseworker. I think that's the most that we've done, but it's been a big help because we were actually going to deny them, and the caseworker reached out and said, unfortunately, she's limited to resources, and so they stepped in to assist. But that's the most we've done.
So your situation doesn't include kind of like the follow-ups from healthy homes upgrades and
No,
education?
that's the most we've done. Yeah.
Okay. All right. Well, that's helpful to hear that. And I think there's a lot of different ways the partnerships can look. The policy isn't very detailed, and again, it's not required. but there can be some benefits. Anyone else have experiences to share on health partnerships?
We do up here, and what we've found really helpful is you get their case manager, whether it's through energy assistance or something. And then there's the HRLP program. So sometimes, the walk-in shower came up. That has been a huge assistance, but usually, they're the case manager in another department. I can't remember which one it's called now, but they'll give us a little info with the client's permission. And then we walk them through, the pros and cons of doing that. Yep, you're going to be without a bathtub or a shower for a couple of days. But to these people, it doesn't matter because they can't use the bathtub. But you got to be really super careful with the HIPAA rules. That's what I would give everybody a heads up is you got to be, and then you always want to make sure that the original case manager is always available or on voice on the phone, on speaker, because if you're at that point with some of these clients, they're really suspicious or they get super anxious or they're very distrustworthy of something. So it's a really fine edge to walk sometimes because you got to always make sure that that third person is involved in it. Otherwise, they start questioning your motives.
Yeah, that's good advice. Thank you. Something else that's come up for us is just the challenge of maintaining a partnership with an external party when the funding for this work can be pretty variable. So then you're asking for referrals, but then you can't take any more referrals because there's no funding to back up to really bring more people in, or you're not able to continue funding any activities by that third party through a subcontract after, you use up your funding. It's often the case that this funding has some gaps. We usually get more. We always get more in recent experience, but sometimes it takes a little while for the next round of funding to show up. Okay, and I see from Michael, Pierce County worked with the health department on a few healthy homes jobs, and that had a great outcome. That's great to hear. I knew that Pierce County had some probably more experience with this kind of stuff than most. Yeah, and I think another aspect of this is when we were doing the pilot, which I think was kind of more in the 2017, 2018 timeframe, there was motive to prove that the measures we're installing had an impact and demonstrate the quality of life improvements and show a linkage between upgrades in the home and improvements in health conditions. And we're no longer in a stage where that's one of the goals of the program. We're not using this for research or to do studies. So I would just say that that's one less benefit than was the case back then. But it's still allowed and certainly can be helpful for your clients to have ongoing guidance and support. And I see Yakima Valley Farm Workers has an asthma program, and they get invited to be guest speakers during the asthma class. So that's a good collaboration. I'm glad that you mentioned that, Crystal, because most of our agencies here are not healthcare providers, but you all have that dimension that's unique. So it's really helpful to hear. Okay. And I think we are on to maybe the last question. Well, I have two more. Contractor procurement selection. Does anybody have anything they want to share about that topic? And especially what I'm curious about, are there measures that you're trying to install in your healthy homes work that required a specialty contractor, that it wasn't something that you could ask an existing contractor to just add on to their suite of services? Anything come to mind as a specialty measure that you really have to find a unique contractor to perform.
Ross, is specialty considered flooring?
Sure, yeah. So
Okay,
that's an
we did.
example
We
for you.
actually used one. Okay, we used, we have a subcontractor and they not specialized in flooring, so we used one of our HRGP contractors, but we gave them we gave them the connection, so it's like they're still handling everything with any additional they subbed out our HRGP contractor. So we
Got it.
didn't have to be in the middle of it. But that's
Yeah.
what we did. That was actually one of my questions. I was wondering if anybody else had used their HRGP or heat contractors for your main subcontractors, or if that even was allowed.
Yeah, and that, I don't think we really quite touched on that subcontracting topic, but it sounds like, Louisa, you have a general weatherization contractor and they subbed to the flooring contractor. Got it. Okay.
They did.
Yeah.
And
That's
they got it done
helpful.
pretty fast. They didn't have to look around or anything like that. We already had the connection and they worked with them right away.
Yeah,
Got it
that's
done pretty
good.
quick.
I see that Chris mentioned wheelchair ramps as being something that they went to a unique contractor for. That makes sense. Any other measure types that required a special contractor? Okay, feel free to add if you think of anything. And I'm going to move on to our final topic, which is interesting scenarios. So we avoided diving deep into any rabbit holes along the way of our slide presentation. Now would be a fine time to share something that you maybe struggled with or could use some advice on, or something you learned along the way with a challenging situation. Anything come to mind for anyone?
I have one. So we had a water leak behind a dishwasher. And the people that pre-owned the house were kind of height impaired. So they had 28-inch tall cabin or in their kitchen countertops are only 28 inches tall. The contractor that did that took the counters out and cut the flooring out and cut the floor joists down so the dishwashers and stuff would fit in there. We don't talk about what a joy it was to fix a water leak because we had to recut out the whole floor in the kitchen to pull the dishwasher out. Because dishwashers are 30 inches tall.
Yeah.
It was very interesting. So if anybody comes across that and figure out a better way, please let me know. It was against a wall, so no, we could not cut the floor out from the crawl space or the basement.
Yeah, that's a tricky one. I'm almost wondering, could you cut out the exterior wall and cut a big hole in the exterior wall and pull it out that way? But that seems pretty insane. That's probably more complicated. Yeah, that's a great example. Any others that people have run into?
We had some. I was still fairly new, so I was trying to find the emails and stuff to see exactly how it went down. But we essentially had a client with COPD, and we had if I remember right, there were some MERV filters that we were gonna do and something. So we had some at the time wilderness plus health funds going into the project. But what had happened is while they were doing the floor blow, it blew into the house
Yeah.
through one of the vents. I think the dryer vent, if I remember right, or somewhere along that line, or oh, it was the wall blow, and it came through, I think, through where the dryer was. Either way, so that was an issue, and we were trying to give them some hotel housing, like the emergency type thing, and we were having all kinds of issues with the procurement and our side of it, and our director saying we won't do that. Well, long story short, our contractor, Arrow, just paid for it. But it was like it was Friday, right at the end of the day. And so trying to get a hold of somebody in the commerce to see how we could do this, if we could put it on a card or whatever. It was a little crazy, but yeah. So maybe some kind of emergency thing would be kind of cool too.
Yeah, I think most of our agencies have probably run into that kind of thing where just doing the work that we do introduced new hazards, at least during the time of the construction project, for people who are especially sensitive. That's a great example. Thank you. Anything else, anything that people have been struggling with that could use advice on while we have this large group of big collection of experience here?
I had something that happened. I did an energy audit last week, and the client had a 4-year-old kid who had asthma, and they had 2 wood single pane windows in addition to a manufactured home that tested positive for lead and were chipping pretty bad. I think we're going to pay for them in this case with utility funding, but in some of our houses, we wouldn't have the same utility funding to replace that. So it might be a good option for something to do under weatherization plus health. Have that option for areas where utility funding might not be an option. Yeah.
Yeah. What about that? I mean, if you have children who already have documented high blood lead levels, is that a justification that's good enough to go in and address, especially the highest lead hazards in the home, where it's peeling, where there's a friction or impact surface, where lead paint is getting disturbed? Does anyone have experience getting approval to use Healthy Homes funding for that?
I think that would be a really interesting aspect to bring up. I think all previous experience that I've had with that was always under the time period where we either had CDBG, which had some allowance for lead paint, or lead Healthy Homes Control Grant funding. So we were kind of pairing that with weatherization as it is. But it sure seems, I mean, our pollution source survey brings it up and talks about lead as an active hazard in the home. And if we know where it is, and we can kind of focus, like you were saying, Ross, to the most hazardous or likely hazardous location.
Yeah, and especially where you have this, like, again, blood lead levels that have been tested and confirmed to be elevated. That seems like one of the stronger links between a health condition and hazards in the home that we could find. So interested in seeing where we could go with that to be the, be the solution. Okay, so I think maybe now is a good time to move on since we're getting close to time. I'm going to go back over a few of the things that I noted for follow-up and help me find what I'm missing. Okay, so we're going to look at policy 6.9A. Oh, I can't remember what that one is, but I think maybe is the over limit request form, where it says $35,000 for tier 2 threshold, but is that right? Okay, where the policies, so that's an exhibit, but the policies have a $25,000 threshold. So just clearing that up. Also, just 6.9A uses weatherization plus health as the term instead of healthy homes. So probably an update needed there. I think, Maria, you already said you're working with Eric on that one. And same thing, I believe, with 9.1.2B, which I think that means is an exhibit, that the plus health language also needs to be updated to healthy homes. clarification on healthy home evaluator certification as meeting training requirements. If it's expired, does it count for anything anymore? I think the answer is going to be no, and that you should just do a training. But it's not entirely clear in the current policy, so we're flagging it. Let's see what else. Making forms fillable. I noted that one, Stephen requested. I don't know if that was for 6.9A or 9.2.1B, but it might be both. You know, let's make the forms fillable.
Yeah.
So I'm just going to note both of those. There was some controversy about whether to share the observed conditions form after it's been filled out with a property owner / landlord when that form includes information about health conditions for the household, the client household. That seems to be a major privacy concern. Even though the form itself says share it with the owner, I would advise all of you to avoid doing so until further notice because of that concern about health information. And we're going to be looking for clarity on that one. And then just the pretty minor note here that 9.2.1 has furnace filters mentioned, but doesn't have the MERV rating. So we might want to add that into that location, even though it is mentioned elsewhere. And then another one, I didn't know the exact locations, but where we list the measures looking to change mold abatement to mold remediation. I'm not going to list the changes to slides that we're going to be making, but there's a few ways that we wanted to change the wording on some of our slides before we send them out. I'll work with Jake on those things. Anything else that came up that I am missing that people needed? Answers to questions, clarification, guidance?
So my question would be is, it says 6 filters, but we can give them up to 2 years? Is there going to be a cap on that?
I think there were 2 different locations, Chris. I think it was for furnace filters, it was 6 filters or 2 reusable. And then it was the air filtration system where it said 2 years worth of filters. So I think that that probably goes to the, like, how do those 2 sections mesh together where it's furnace filters versus air filters? One has to do with HVAC, one has to do with maybe a portable filtration system.
Is that, Chris, maybe can you say more about which thing you're looking at there so we can see if there is something we want to change?
Well, it was on one of your slides, if I remember right.
I can pull up. No, I don't want to. No, I don't want to close it. Now I need it.
While you're doing that, Jake, I do want to note that we are at time, and I recognize that some people aren't probably able to stick around to hear where this discussion goes. So maybe we could just do a quick wrap up and follow up on that one later. I think Donnie mentioned that he had the same note for clarification. I think that's about the filters. So we'll look at that one. And I guess with that, we could probably, Jake, are you okay with concluding the workshop and we can just kind of follow up later on?
Yep, sounds good to me.
Okay, well, thanks everyone for joining us for this first of our Healthy Homes program workshops. And it was a little bit of an experiment or a pilot or whatever you want to call it. But it feels good to do a deep dive and get some clarity, hopefully. There's a lot of really important work we can be doing here. And this is going to help us. So thanks everyone for your participation.
Agreed. Thanks, y'all.